Immunodeficiency Virus among the youth for the purpose of strengthening the existing comprehensive sexuality education of the Department of Education and integrating effective preventive measures in the basic education system. We would like to acknowledge our resource persons. From the Department of Education, or DepEd, we have Yusek Philemon Ray L. Javier, the Undersecretary for Legal and Legislative Affairs.
Good morning, Your Honor.
ASEC Janier T. Datukan, Assistant Secretary for Curriculum and Teaching.
Good morning, Mr. Chair.
And ASEC Dexter A. Galban, Assistant Secretary for Operations.
Morning, sir.
For the Department of Health, we have Dr. Jose Gerard Belimac, Director 3 of the Disease Prevention and Control Bureau, Dr. Maria Elizabeth Calubag, OIC Director 3, Disease Prevention and Control Management Bureau, Dr. Jerna M. Manatad, Director 4 of the Epidemiology Bureau, and from the Philippine National AIDS Council, or PNAC, we have the Executive Director, Dr. Joselito Feliciano. From the Department of Social Welfare and Development, or DSWD, we are still waiting for USEC Fatima Aliyah Dimapore, the USEC for Legislative Affairs, but we currently have Mr. Agustus Lito M. Narag, Division Chief of Beneficiary Data Management Division. Sorry, ma'am. Yeah. Thank you.
Good morning, Senator
USEC is
Gatchalian.
already here. Thank you, ma'am. From the Department of the Interior and Local Government, or DILG, we have Mr. Joselito S. Magumon, Assistant Division Chief of the Bureau of Local Government Development, Local Administrative Development Division, and Mr. Albert M. De Los Santos. From the Philippine Statistics Authority, we have Mr. Teodoro M. Orteza, Chief Statistical Specialist, Mr. Marjorie Villaver, Supervising Statistical Specialist, and Mr. Bernard V. Corrales, Legal Assistant of the Legal Service. From the Commission on Population Development, or CPD, we have the Deputy Executive Director, Lolito R. Tacardon. From the National Youth Commission, or NYC, we have the Assistant Secretary and Commissioner representing Luzon, Attorney Rina Vivian C. Pineda. From the National Coalition for the Family and Constitution, or NCFC, we have the National Director, Pastor Carlo M. Dino, together with the former Supreme Court Chief Justice Maria Lourdes Sereno, the Chair of the Legal Advisory and Public Policy Review Commissioner, or LAPPRCOM, of the Philippine Council of Evangelical Churches.
Good morning, Mr. Chair.
Good morning, Mr. Chair.
Thank you, ma'am. From the United Nations Population Fund, or UNFPA Philippines, we have the country representative, Dr. Laila Saji Judin, together with Mr. Jose Roy Avena, the UNFPA Assistant Country Representative. We are still waiting for the representative of Child Rights Network, the convener and Executive Director of PLCPD, Mr. Romeo C. Dongueta. Thank you, Mr. Chair.
Thank you, Comsec. Once again, thank you very much for joining us today, and thank you very much for coming over to the Senate. Today, we'll be discussing DO31 in particular, and we will focus on this topic. And I understand that DO31 was in response to our challenges in teenage pregnancies, our challenges in youth violence, and also increasing incidents of HIV among Filipino youth. Let me acknowledge the presence of Senator Risa Ontiveros. Good morning, ma'am.
Good morning, Chair. Good morning, everyone.
So, like I was saying, DO31 was promulgated in order to respond to these challenges that are being faced by our youth. And today we will focus on this, the implementation of DO31. We would like to know the rationale for DO31, the legal basis for this department order. We would also like to understand the methodology or the mechanisms to implement this on a nationwide basis. We would like to also understand the challenges and issues faced during the implementation of this department order. I understand that the department order was implemented on a pilot basis in Region 1, Region 7, and Region 11. And we would like to understand the learnings. Of course, we undertake a pilot to learn so that before implementing it nationwide, we will pick up some concepts, some problems and issues, and correct them along the way. We would like to understand also ways forward in implementing DO31, particularly in the implementation of the comprehensive sexuality education. For the information of everyone, DO31 focuses on the implementation of the country's first comprehensive sexuality education. And we would like to understand thoroughly the rationale and the implementation of this program. So with that, before I continue and call on our resource persons, I would like to hear an opening statement from Senator Risa.
Salamat po, Mr. Chair, at muli magandang umaga po sa inyo at sa lahat ng ating mga resource persons. I don't actually have a prepared opening statement and handa po akong makinig sa lahat ng ating mga resource persons at makapagtanong ng ilang mga tanong, particular, gaya ng sinabi ng Chair, kung kumusta na po yung pagpapatupad ng Department of Education ng Comprehensive Sexuality Education, ano po yung mabubuting bunga so far, ano yung mga problema, ano yung mga pagkukulang, para kami po dito sa Senado bilang mga legislators na dapat ay nagkukonsulta, nakikinig, ay pwedeng suportahan ng DepEd. At ang mga civil society organizations din na nasa mga komunidad, kasama ng mga community youth at lahat ng mga magulang at syempre yung ating mga guro sa mga eskwelahan ay matulungan kung paano isaayos o pagandahin ang dapat pang pagandahin at isaayos. And I will do all this this morning, Mr. Chairman, in that spirit of valuing and preserving yung maraming unities na mayroon na tayo around the table sa nakaraang mga taon na sinusulong natin yung karapatan at kagalingan ng ating mga estudyante at ating mga anak, in the spirit also of sa mga area na hindi pa tayo ganap na nagkakasundo, ay patuloy na pag-usapan ng mga ito para idagdag sana sa mga areas of unity and sa lahat ng mga bagay na ito, yung marami na nating pagkakasundo at yung mga area din na hindi pa tayo nagkakasundo, to engage in all that in the spirit of charity or even love, Mr. Chairman. So, salamat po, Mr. Chairman, at sa lahat po ng ating mga resource persons.
Maraming salamat, Senator Risa. Just to put on record, the title of DO31 series of 2018 is the Policy Guidelines on the Implementation of the Comprehensive Sexuality Education. And this was promulgated July 13, 2018. And again, to put the discussion in proper context, based on our research, I'll flash on this side. In 2013, we have about 142,000 cases of teenage pregnancies just in 2013. Although this is far below the number in 2012, which is about 209,000. So even though the country is progressing in terms of reducing the incidence of teenage pregnancies, we still have about 142,000 cases of teenage pregnancies. And what is quite alarming, actually, are the incidences of HIV in our country. In 2019, we have about 629 cases of HIV cases from children aged 19 and below, youth aged 19 and below. In 2024, it increased to about 1,059 cases. So that's why those two important data points became the rationale for the promulgation of DO31, which calls for the implementation of a comprehensive sexuality education. So with that, we'll call on the Department of Education, because this will focus on that particular department order. So give us the rationale, the implementation, and of course challenges and ways forward.
Good morning, Mr. Chair, Senator Gatchalian. Good morning, Senator Hontiveros. I'll begin, sir, with your query. What's the legal basis of Department Order 31 when it was issued in 2018? Based on the records, sir, it would appear that Department Order 31 in 2018 was issued to comply with the requirements under the RH law in Section 14, because in Section 14 of RH law, Your Honors, there is a requirement for the Department of Education to formulate a curriculum with respect to the law, Your Honors. And that is why DO 31 was issued. Admittedly, Your Honors, when you read DO 31, there are some references to UNESCO. particularly the definition of comprehensive sexuality education. Your Honors, I have with me the Assistant Secretary for Curriculum, which may assist us, Your Honors, in discussing the rationale of DO 31, and the Undersecretary for Operations, which may assist us in discussing the challenges that we have faced implementing the department order. If I, with your permission, Your Honors, I refer to first to the Undersecretary for Curriculum and Teaching.
Yes, go ahead, Asek.
Good morning, Mr. Chair. On a curriculum point of view, the curriculum for the comprehensive sexuality education adapt a grade level, age and developmentally appropriate approach that include learning competencies which anticipate biopsychosocial milestones of by about 2 years. The topics include human development, personhood, healthy relationships, sexuality and sexual behaviors, sexual and reproductive health, gender, culture, and human rights. These are integrated in multiple subjects such as MAPE, Araling Panlipunan, Edukasyon sa Pagpapakatao, and Science. Basically, what we did, Mr. Chair, is we mapped all of the competencies in our curriculum, and then we matched it with those that indirectly or directly address the comprehensive sexuality education.
You can continue with your presentation if you wish.
Yes, Mr. Chair. So in this case, we can see the DepEd CSE framework. Again, this was decided on by a series of consultations with experts and specialists in the field, and they came up with this framework where many different facets of the comprehensive sexuality education are really ingrained and incorporated in what is existing in our curriculum. Next slide, please. For integration of the teachings in the curriculum, hold on, Mr. Chair. Let me just... So teachers employ learner-centered, appropriate to to deliver the comprehensive sexuality education curriculum, encouraging active participation of the learners, critical thinking, and reflection. So they create safe and inclusive learning environments by allowing them to respect each other and to treat each other even though they're different. You know, they treat each other as fairly as possible. When students feel comfortable asking questions and responding to sensitive topics. So some examples of how CSE concepts are integrated in the different subject areas is, for example, in science, there's a discussion on puberty, reproductive health, and of course, STIs. For MAPE, there are lessons on personal hygiene, sexual health, and responsible decision-making. For ESP, we have exploration of values, ethics, and respect in relationships. And for AP, Araling Panlipunan, we have examination of gender roles, cultural norms, and human rights related to sexuality. Next slide, please. So for the monitoring and evaluation of the CSE implementation, we have data collection efforts, number of school implementing CSE, and the number of teachers trained, and the reach of the program itself. We have mechanisms for doing the M&E. We have pre-test and post-test and teacher observation forms and classroom observations, including interviews and focus group discussions. Next slide, please. That's the last slide, Mr. Chair.
Thank you. Senator Risa, you want to do the honors to start off with questions?
Alright, salamat po, Mr. Chair. Siguro, i-follow up ko yung initial presentation ng DepEd sa ating USEC at mga ASEC din. So, Mr. Chair, in the briefer that DepEd released earlier this month, you reported that 11,079 PTA, PTC parent representatives from pilot, as the chair was mentioning, pilot and non-pilot regions were trained and oriented on comprehensive sexuality education. So ano po yung breakdown nitong CSE parent orientations? Pwede niyo po bang ibahagi sa komite namin kung ilang eskwelahan ang involved sa bawat rehiyon, pilot regions at saka non-pilot regions, at ilan pong mga guro ang na-train sa CSE as of 2024, last year, Mr. Chair?
Mr. Chair, let me pull out that data.
Madam Chair, while ASIC Engineer is looking for the breakdown of the PTAs trained, based on our data sets, we have been able to train 400,000 teachers on CSE, specifically the more sensitive and more complex aspects of CSP that is separate from their inset or their in-service training.
Tapos may bilang na po ba ng mga parent orientations? Kasi di ba dun sa DepEd, yung CSE hindi lamang para sa mga estudyante, para din sa parents and guardians, and of course para sa teachers. So ano naman po yung breakdown ng CSE parent orientations?
I'm trying to locate that data, Mr. Chair.
Thank
My
you, Asik.
apologies. If you can give me more time po.
Yes, certainly, Mr. Chair. At pati po sana kung ilang mga eskwelahan ang involved per region at saka ilang mga guro ang nasanay din sa CSE as of 2024. May I proceed, Mr. Chair? Or, salamat po. So, since the issuance of this DepEd Order 31, series of 2018, so going on 7 years na, ano po yung main bottlenecks na nagbabagal dun sa faithful and effective implementation of CSE? At sa bottlenecks na yon, anong measures ang ginawa ng DepEd para tugunan itong mga bottlenecks na ito, Mr. Chair?
Madam Chair, in terms of the implementation of DO 31, of course, the initial challenge should be the familiarity of our teachers when it comes to the content. And this was supplemented by conducting teacher trainings. It was included as part of the in-service training, which covers all teachers as part of their mandatory annual training. But apart from that, we also pushed for the specialized training of CSE-oriented teachers, which, as I've mentioned earlier, about 400,000 teachers have been trained on that matter. And our goal is to hopefully eventually get all teachers accustomed to knowing how to effectively handle CSE as a topic for our learners.
So, Mr. Chair, 400,000 specialized teachers. Sa kabuang, ilan po ba ang human resources ng DepEd na eventually may involve sa implementasyon ng CSE?
The universe of teachers that we have, Madam Chair, is a little over 800,000. So we're roughly at around the halfway point, although we would like to note that we prioritized, of course, the specialized training of CSE for the teachers that are handling the older demographics, particularly those handling the adolescent age bracket, as intended to by law. And at the same time, we also had a bit of challenge, particularly in terms of coordinating with other government agencies that have pro-adolescent health and well-being services, particularly services that may be offered by the DOH, the SWD, and the like, when it comes to a myriad of reasons on teenage pregnancy prevention, whether it be OSAIC, CISAM, or several other considerations on that matter. More so that in terms of the universe of learners that we're able to monitor, we would only be able to monitor those that are within the school premises. So out of school youth, teenage pregnancies on that regard, we might not be able to provide direct intervention to if they are not part of the basic education system.
Salamat, Mr. Chair. I'd be interested, and the committee would be interested, I believe, to hear more ano yung bottleneck sa coordination among other government agencies. And I'm sure, Mr. Chair, maitatanong din po natin during this hearing sa Department of Health. Salamat po dun sa pagbanggit nyo, ASEC, na hindi masaklawan ng DepEd yung buong concerns about online sexual abuse and exploitation of children or OSAEC, at saka yung CSAM or Child Sexual Abuse and Exploitation Materials, na nakapagpasa na rin po kami dito sa Senado ng mga batas para ma-empower yung law enforcement agencies, yung community organizations, yung parents sa mga komunidad, pati po yung mga internet service providers, social media platforms, pati financial intermediaries na labanan itong OSAEC at CSAM. And I just want to make it a record, Mr. Chair, importante din ito kahit sa incidents at pagpapababa natin sa incidents ng teenage pregnancy, dahil yung vast majority ng mga partners ng mga batang ina natin o yung mga ama ng mga babies, ng mga batang ina ay much older than them. So nag-indicate ng power imbalance talaga, and the high probability of abuse, even rape of these teenage mothers na ina-exacerbate, fina-facilitate din ng OSAEC at CSAM. And salamat din po, ASEC, sa pagbanggit nyo na syempre ang saklaw lang ng DepEd ay within the school premises. Kaya importante na yung CSE ma-implementa, ma-evaluate, continuously ma-improve, maiayos yung mali, mapuno yung gaps, also for out-of-school youth or community-based youth. At may tulad sa aming mga magulang sa mga eskwelahan and guardians and teachers, ma-empower din yung mga magulang and other responsible adults sa mga komunidad, tulungan yung ating mga out-of-school youth, maiwasan ang teenage pregnancy, at kahit mabuntis na sila, manganak na sila, mabigyan ng social protection para magbalik-aral, magtapos, turuan yung paano nila alagaan yung mga babies nila, at matulungan sila na maiwasan ang paulit na teenage pregnancy. If I may continue, Mr. Chair. So in our current CSE curriculum, aside from the biological aspects of reproductive health, yung abstinence po ba, hindi ba ito po ay dinidiscuss din bilang isa sa mga paraan na mapigilan ng teenage pregnancy at saka STI prevention? At kung oo, paano din po ito ini-incorporate sa ating curriculum, Mr. Chair?
There's actually no really discussion on abstinence because you don't really talk about sexuality and sex in the curriculum. What we do is we map things. So we talk about these topics as fundamental or basic, science concepts. And even dun sa choice ng mga bata, those are incorporated in other subjects like ESP, at saka po sa MAPE, it's not really explicit na talking about, we don't encourage or we don't discourage them from engaging in such acts. So it's of sexuality education encompasses.
Okay. Although ang understanding ko po, Mr. Chair, sa comprehensive sexuality education, na lalo na dun sa binanggit ni ASEC Galban kanina na older demographic, na eventually, pag age appropriate na at pag developmentally appropriate na, lahat ng pamamaraan ng pag-iwas sa teenage pregnancy ay matatalakay. So I'd be curious moving forward how DepEd intends to discuss with the older demographics all the methods, including abstinence. And then, just for further sorry po, Mr. Chair, baka si ASEC Galban would like to add?
Madam Chair, the rollout of our adherence to the RH law also constitutes not just the curricular component, but also the promotion of adolescent reproductive health services as mandated by the law. And this focuses primarily on our coordination with other government agencies. So I will provide as engineer the platform to discuss the content, but on the part of the service delivery, our referral mechanism, we focus on presenting basic data sets as to effectiveness of different family planning interventions. So inclusive of that would be your abstinence. Of course, abstinence would have 100% effectiveness vis-a-vis other family planning mechanisms, whether it be your traditional and your modern family planning mechanisms. And these are presented as facts from a health, medical, and clinical perspective. So it provides that platform through the help of our health personnel that are within the Department of Education by coordination with the Department of Health. And this is also why we hope to activate a more effective coordination system, more so, for example, with the DSWD to activate their services on protecting in case that we have learners that become young mothers. They know that there are government services that are there to provide them with assistance. And for those that are affected by abuse, they are knowledgeable as to where to report them effectively within the government system. All of these are part of the adolescent reproductive health services that we provide.
Thank you so much, Mr. Chair, at kay ASEC sa pagbanggit yung in a way yung pagiging progressive nung from legislation natin to jurisprudence to implementation na by the executive. And yung salamat sa pagbanggit nyo sa from abstinence to other traditional and modern family planning methods na kapag age appropriate na and developmentally appropriate na, kasama sa content na natatalakay with the older demographics. And indeed, abstinence of course is 100% effective, and then to varying degrees other traditional methods. And for those youth and students who are already sexually active, then nagiging relevant and helpful yung pagtalakay sa modern family planning methods para makaiwas sa teenage pregnancy. If I may, Mr. Chair, I'd also like to ask DepEd for clarity. Yung CSE program ba ay nagtuturo sa mga bata na kasing bata ng 0 to 4 years old tungkol sa childhood masturbation? O what about anal sex, oral sex? Tinuturo ba iyan sa ating mga eskwelahan, Mr. Chair?
Mr. Chair, no. There's nowhere in our curriculum that teaches these things to learners between 0 to 4. Hindi po cover din natin yan kasi ang mga learners po natin nagsa-start at 5 years old sa DepEd. And like we said, all of the competencies that we have under this called comprehensive sexuality education are mapped with existing learning competencies already there in the curriculum.
Salamat po, Mr. Chair. ASEC, malinaw po yun. And huli po, Mr. Chair, para sa DepEd, at this point in time in our hearing, ang RPRH law po ba, yung kumbaga, yung pinagmulan, in a way, no? Pinag-ugatan din ng DepEd Order 31. Ang RPRH law ba, pinipigilan ba tayo mga magulang na magpayo sa ating mga anak o gabayan yung ating mga anak sa mga matters kaugnay ng sexual and reproductive health? Bilang abogado din yung ating good secretary ng DepEd at kayo po, dear resource persons from DepEd, malamang kung di man lahat, marami or ilan sa inyo bilang mga magulang din, sa opinion nyo po ba, itinatakwil ba ng CSE ang parental authority natin, Mr. Chair?
Hindi po, malayo po yan sa katotohanan. In fact po, ang CSE ay supplementary. Hindi po siya meant to supplant or override the parental authority of the parents over their children. Kaakibat lang po ito, suporta lang po ito. Madam.
Salamat po, Mr. Chair. Magandang paglilinaw po yan at pag-affirm, no, sa ating mga magulang at guardian at yung tamang ugali din ng ating mga guro kaugnay sa atin. At kaya rin po ako, Mr. Chair, nagsimula sa mga tanong ko sa DepEd tungkol sa mga parent-teacher associations at yung mga PTC parent representatives at tungkol sa mga parent orientations. Dahil ang appreciation ko rin po sa DepEd Department Order number 31, series of 2018, at na sinasalamin sa mga sumusunod na executive and legislative initiatives ay nag-e-enhance dun sa primary na educational experience ng ating mga anak sa tahanan at kasama tayong mga magulang. Pero bilang ang mga eskwelahan at mga guro ay partners. And ang inaasahan po natin para din sa out-of-school youth natin, para sa ating mga kabataan at mga responsible adults sa ating mga komunidad. So, na walang pagpipigil, bagkus ay kino-complement. And in fact, dinadagdagan yung capacitation para talakayin nga itong usapin ng comprehensive sexuality education. So, for now, Mr. Chair, those are my initial questions for the DepEd. At maraming salamat po sa resource person sa DepEd. Salamat po, Mr. Chair.
Thank you, Senator Risa, for starting off with the DepEd. I'll continue the inquiry with DepEd. And I'll go to the basics first because we wanted to learn the legal basis of this DO31, which is the implementation of the comprehensive sexuality education. And I heard Yusek Javier that the legal basis for this is the reproductive health law, which is RA 10354.
That is correct, Mr. Chair.
We took a look at the RH law, and in section 14, let me just flash it on the slide. Slide 50. Section 14, age and development appropriate reproductive health education. The state shall provide age and development appropriate responsible parenthood and reproductive health education to adolescents and school-age children, which shall be, this is the IRR to, yung batas mismo. Page before. Section 14, slide 50. Let me just read it. Section 14, age and development appropriate reproductive health education. The state shall provide age and development appropriate reproductive health education to adolescents, which shall be taught by adequately trained teachers in formal and non-formal education system and integrated in relevant subjects such as but not limited to, and it goes on. There. So this is the legal basis for DO31. Is that correct? You said
That is correct, Your Honor.
okay. And in this section 14, it's very, very specific, no? And we have to remember RH law was debated for a very long time. No? This is not an ordinary law. It was debated, it was a heated discussion inside Congress, inside Senate, and outside Congress and outside Senate. In fact, this was a very well discussed bill by the entire Philippines. No? And when they were formulating the different provisions of this law, there were a lot of debates per provision of this law. And in fact, this went all the way up to the Supreme Court. Is that correct?
That's correct, Your Honor.
Okay. So in this section 14, it's very specific. No? It calls for reproductive health education to adolescents. Okay. And may I ask you, Sec, what age constitutes adolescents?
Under the law, Your Honor, and even in Department Order number 31, it's 10 years old up to 19 years old.
10
Your
years
Honor.
old up to 19 years old.
Yes, Your Honor.
So in here, we have to implement a reproductive health education to children aged 10 to 19.
That's correct.
And also in the law, it's very specific, wala lang sa slide, that DepEd is the lead agency that will implement this. But when I looked at your DO31, slide 55, no? And you mentioned because the RH law was the legal basis, in Department Order 31, it mentioned comprehensive sexuality education, age-appropriate, culturally relevant program to teaching about sexuality and relationships by providing scientifically accurate, realistic, and non-judgmental information. And it will be implemented, and this policy will be implemented, and I'll read it. The policy shall apply to all learners of public and private elementary, junior, senior high schools, and of learning centers for special education, etc., etc. No? So, I see a disconnect. Because if you are telling us that the legal basis here is the RH law, the RH law is very clear in emphasizing that reproductive health education will be taught to adolescents, and adolescence is universally defined as children aged 10 to 19. But when you go to DO 31, there's a disconnect. It calls for the implementation of a comprehensive sexuality education to all learners in public and private schools. And when you say all learners, this is from K all the way to grade 12. So on legal basis alone, USEC, meron na tayong disconnect dito eh.
We can explain, Your Honor.
Go ahead.
Right, Your Honor, under the law, it's correct. It's 10 years old to 19 years old. But when we issued, the Department of Education issued the Department Order number 31, it was meant to be comprehensive. And one of the ideas would be, Your Honor, is to prepare the children for the sex education proper, which is 10 to 19. So what the curriculum did, what the Department of Education did, is to map and to align existing subjects already, Your Honor, which would have been done even in earlier stages of the education system, like kindergarten. But it's not the sexual education proper. It's just foundational knowledge, Your Honor. For example, in kindergarten, just the parts of the body, 5 senses. So that's why, Your Honor, when Department Order number 31 was issued, it was mentioned that for all learners. But in reality, Your Honor, the sexuality education proper, and it will be shown in the details of the curriculum, would only begin at 10 years old, Your Honor. Prior to that, it would just be foundational. It would be subjects that would otherwise have been taught, even if there is no comprehensive sexual education order from the Department of Education, Your Honor.
No, I understand that, no? But we'll talk about how this policy will filter all the way down to the last teacher. At the end of the day, this policy will be taught by every single teacher, all 800,000 of them, inside our 47,000 schools nationwide. No? So, in other words, the policy should be very clear from the onset, or else you don't expect 800,000 teachers to sing the same tune if the policy is confusing, correct?
That is correct, Your Honor. And in fact, the current leadership of the Department of Education acknowledges the fact that there may be some instances of confusion. That is why we have a directive currently, Your Honor, to review Department Order 31 and revise if necessary and ensure that the implementation will be properly done, Your Honor.
Yusek, this is a very culturally sensitive topic. Like I said, no, the RH law was debated for a very long time. And it's very rare for a law to go up to the Supreme Court if it's not controversial or contentious, correct? So we admit that this RH law is very contentious. And when this law was approved, the policy was, during that time, was to implement a reproductive health education to adolescents. That was the clear policy. Yes, sir. But DO 31 diverted from that policy, correct?
Your Honor, with due respect, Your Honor, it would appear, Your Honor, that when they issued, when the time that it was issued, they also meant to implement Department Order 31 proper for 10 years old to 19. It's just that, Your Honor, the children must be prepared before they are taught of the proper or the actual sexuality education. There must be some foundational knowledge.
But you mentioned earlier that the legal basis is the RH law.
That is correct.
So we have to anchor on that.
Yes,
we have to be very clear to all of us policymakers that that is the legal basis where all of these programs emanates from.
Yes, sir.
Right? So that everything will be filtered down to the teachers very clearly. But if you're saying that there is confusion, then how do we expect our teachers to teach CSE with clarity on the ground? We have to make sure that all the 800, we're talking about close to 1 million teachers who will implement this. But from a policy standpoint alone, it's already, like you said, confusing. Then how do we expect teachers to teach with clarity?
That is why
Mr. Chair, if I may add to the question of the chair.
Yeah.
Mr. Chair, just to add, EO 12, Executive Order 12 of January 2017, is also cited as the legal basis for the DepEd memo. EO 12, in which DepEd was tasked to implement CSE in the school curriculum. I don't know, Yusek, if that's a useful addition,
Yes,
piece of information
yes,
that you
Your
can
Honor.
use to answer the question of the chair.
EO 12 is also specifically stated that DepEd is required to strictly implement RH law. And in fact, in Section 3 thereof, Your Honor, it's stated that DepEd shall implement gender-sensitive and rights-based CSE in the curriculum, Your Honor. So it's really part of the legal basis. Your Honor, if I may respond.
I asked you in the beginning, and that's why I started off with the legal basis. So, but everyone will be on the same plane.
Yes, sir.
Of course, all of this, I know that there's an IRR subsequent to that. There was EO 12 subsequent to that, 2017, and there's DO 31 subsequent to that in 2018. But we go back to the original basis. The original basis are the RH law.
That's correct.
Correct? And that's why I asked you that. And that's why we see that inconsistency. I think we have to, in my opinion, we have to stay faithful to the intention of the framers of that law, that reproductive health education should be only taught to adolescent children, because that was the policy agreed upon during that time. And that should filter down all the way to our teachers. But in DO 31, naging ano siya eh, naging iba siya eh, naiba siya sa RH law. It was expanded all the way to kindergarten, which is different from the intention of the framers of the RH law.
That's correct, Mr. Chair. In fact, Mr. Chair, we are aligned, and DepEd is aligned also with that thinking that sex education, sexuality education must begin from 10 to 19 years old, because that is what RH law provided. But with respect to DO 31, Your Honor, it's generally worded. But to ensure that the teachers will not be confused, our curriculum strand issued when you look at the curriculum itself, there are details, Your Honor, of what should be taught per grade level. And if we will look at the details of the curriculum, the sexual education proper will begin, Your Honor, at age 10 and will end at age 19. So the teachers will be guided, even though admittedly, Your Honors, the wording of DO 13 at the current state is confusing. There are details provided for by the curriculum.
I don't, when we say confusing, it's quite concerning.
Yes, yes. Your Honor, we acknowledge that. And in fact, the current leadership is currently reviewing the DO 31. And
For a sensitive topic like comprehensive sexuality education, there's no room for confusion.
we agree, Your Honor.
And Senator Risa made a very good point earlier on teacher training. How many teachers have been trained?
Around 400,000, Your Honor. Teachers are trained in it's a general training, which include sexual education. All of them are trained 100%.
Correct. It's
But-
general training.
But in addition, Your Honor, there is a specific training, a focused training with respect to this topic. About 50% of our teachers were already trained with respect to this program, Your
Okay.
Honor.
But going back to what you mentioned about that confusion, how do you address that confusion? Because I don't agree implementing a law that is, or implementing a department order that is confusing.
Yes, Your Honor. Your Honor, we are, and to be candid, we are in the seat. I'm a 3-month-old undersecretary, and our secretary is just there for 6 months, Your Honor. But the moment that we assumed the office, the directive was to review all of the orders. And now this is a priority review on our part, Your Honor. And in fact, we have been meeting weekly, sometimes twice a week, to ensure that we review Department Order 31. In fact, we will meet again on Thursday, Your Honor, for us to present the new draft, the new wording of Department 31 to our secretary. So, Your Honor, this is a priority subject matter for all of us. And we agree, Your Honor, that is very important because it will affect the lives of our learners, Your Honor. So this is a priority, and hindi po kami bingi, narinig po namin na may confusion, and we will ensure, Your Honor, that it will be worded correctly and it will be implemented appropriately.
And while we resolve that confusion, this DO31 is being implemented right now.
That is correct, Your Honor. There's no decision to suspend it, Your Honor.
Correct. So that confusion is filtering down to our teachers. If the teachers can hear us right now, if they are listening to us right now, confused tayo sa taas, wouldn't they get confused also on the ground?
No, as we speak, Mr. Chair, and even before, clarification has already been made. Because as mentioned, Mr. Chair, the DO31...
I think itong confusion, I'll give you a... If you are a key stage 1 teacher, kinder to grade 3, and then they are hearing this discussion, ang unang tanong niya, ituturo ko pa ba ito o hindi?
We clarified, Mr. Chair. They follow the curriculum, Mr. Chair. The current curriculum has no problem, Mr. Chair. The sexuality education is not being taught to children that are younger than 10 years old. The current curriculum...
It's in your DO. Apply to all learners.
That's correct. It's generally worded, Your Honor, as explained, Your Honor, because there are foundational knowledge, but the teachers will not just look at the DO31. They will be guided by the curriculum itself, Your Honor.
Mr. Chair, if I may add to the question of the Chair, sabi nyo foundational knowledge lang below age 10. Sabi nyo hindi nagkaka-problema doon. Can you show us, specifically Mr. Chair Yusek, can you show us the curricula for learners from ages 5 to 9, Mr. Chair?
Yes, certainly, Madam Senator. I'll refer to the Assistant Secretary for Curriculum, Your Honor.
Mr. Chair.
Go ahead.
Regarding the competencies within our curriculum, like we said, we mapped existing competencies to comprehensive sexuality education without really telling them that, we're going to talk to you about parts of your body, and this is CSE. It's really just part of the curriculum, Your Honor, Mr. Chair. So, for example, in kindergarten, they have to identify their body parts, the things that they see, and then they practice ways of taking care and protecting their body, for example. Sa grade 1 po, we teach them about pagpapahalaga sa under makabansa, nagpapahalagahan ang individualidad ng bawat tao. So there's appreciation in differences among learners, people. And then ipapaliwanag ang papel at tungkulin ng mga kasapi ng pamilya. Those are just foundational. They're just reinforcing what they need to know in the future. So from the simple parts of the body, when they move to higher grade levels, it becomes more specific. So at this point, natuturuan sila ng mga bagay na ito. We reinforce them so that we prepare them for higher competencies when they move to higher grade levels, without explicitly saying that this is CSE.
Salamat, Mr. Chair Asek, but I hope that as the hearing continues, you can show us so we can see with our own eyes ano ba yung competency sa kinder, sinimulan nyo na sa grade 1, grade 2 hanggang grade 3, para ages 5 to 9, makita namin kung gaano ba ka-confusing pa or gaano nyo na ba nililinaw sa mga teachers para foundational knowledge ang sa mga estudyante na below 10 years old. Salamat, Mr. Chair.
Yes, Your Honor. In fact, Your Honor, as a preliminary compliance with the directive, we have with us a summary of the curriculum. We can provide it to you now, Your Honors, and then we'll provide you the complete curriculum. We'll just prepare.
Thank you, Mr. Chair.
Thank you, Senator Risa. We looked at the curriculum guides. No, you flashed this on page 47. This is for kindergarten. Matatag curriculum. And we saw in one of the learning competencies, number 46, demonstrate awareness of uniqueness, including but not limited to language, gender, color, culture, dress habits, belief, faith, etc., status in life, ability. Is this part of the CSE for kinder?
That's not for kindergarten, Mr. Chair.
This is for kindergarten. It's under Matatag curriculum. Under DO31 series of 2018. And then we'll go to another one. Just check on that later on. For grade 1, this is one of the competencies, and let me just read it. Number 1, naipapaliwanag ang konsepto ng pamilya batay sa bumubuo nito tulad ng two-parent, solo parent, extended family at iba pa, na ipaliliwanag ang papel at tungkulin ng mga kasapi ng pamilya, na pahalagan ang papel at tungkulin ng mga kasapi ng pamilya. Is this part of the CSE for grade 1?
It would seem, Your Honor, Mr. Chair.
Right. And I ask teachers, I ask teachers who are tasked to teach this in grade 1. And this is couched in general language, correct? Can you say?
Yes, Mr. Chair.
And the teachers have leeway and flexibility to teach these competencies, correct?
For CSE, Mr. Chair, they need to have the training in order for them to implement this properly.
Yes, we need to have the training. And you said that there are 400,000 teachers who underwent training.
Yes, Mr.
So
Chair.
that's good. But they're also given some leeway because these are general terms, correct? In terms of concepts or competencies.
That is possible, Mr.
Are
Chair.
they allowed to draw more specific concepts in terms of how to teach these general concepts? Are they given that flexibility to use other references, other materials to teach these concepts?
Mr. Chair, I admit I'm not privy to exactly what the training entailed and cascaded to the field, but there are limitations on what they need to do. They have may sinusunod po silang mga guidelines in order to implement this.
So what are the limitations? I want to understand. If I'm a teacher, lagay ko kung ako yung teacher, yan ang ituturo ko, no? These are general terms, no? So what can I use as a reference to teach that? And what can I not use as a reference to teach that?
Mr. Chair, my apologies, I won't be able to answer that question personally because I haven't really seen I haven't checked yet the training materials for this.
But sino sa DepEd ang kayang magpaliwanag? Because this is the main point of this hearing. Now, we want to go straight to the classroom, and this is what the classrooms are being taught right now. All 47,000 schools are being taught right now. So we want to understand how a teacher teaches this. Because from my interview with teachers, they are given flexibility to use reference materials if they are not, if they have if they want to get other direction on how to teach these general terms, they are allowed to use reference materials. Yun ang naintindihan ko sa mga teachers natin when I ask them. Is that how it works inside the classroom?
I believe, Mr. Chair, there are prescribed materials that they can use. It should have been taught during their training. So, limited din po yung mga materials na pwede nilang ipakita if they're...
What kind of materials ang pwede nilang gamitin as reference? Kunwari ako, sinasabi niya, ako teacher, ituturo ko yan. Hindi ko masyadong kabisado kung paano ituro yan. What type of materials and references I can use to teach that? Meron bang ganyan?
I will not be able to answer that accurately for now.
Can teachers use the UNESCO technical guide on CSE?
That is a reference, Your Honor, Mr. Chair, but not in its entirety that we follow exactly the UNESCO
But can a teacher use that?
They can still use it as a reference, but they have to adapt it to our circumstances po here.
Dapat
Yes,
culturally
po.
appropriate.
Yes, sir.
But they can use the UNESCO.
You can use it po,
Okay.
pero it has to be localized.
That's why I took a look at the UNESCO. Kasi I was asking teachers about this, and I was very curious on how teachers will implement this. Importante kasi not in this room. Importante in classroom. We have to make sure that it's implemented uniformly in the classroom. And the teachers know how to respond. No? And that's what I understand, that the teachers can use reference materials. That's why when I looked at the UNESCO standard, anong page yun? Where's the UNESCO? for example, itong UNESCO, this is the it's called the UNESCO International Technical Guidance on Sexuality Education. And in their concept, CSE should start as early as 5 years old. And they divided it into 4 groups, 5 to 8, 9 to 12, 12 to 15, and 15 to 18. And in the one of the concepts for 5 to 8, ito yung key idea nila. Nakasulat dyan, key idea, it is natural for humans to enjoy their bodies and being close to others throughout their lives. Understand the physical enjoyment and excitement are natural human feelings, and this can involve physical closeness to other people. And it goes on. So, tinuturo natin sa mga 5 to 6 years old, kindergarten to, key stage 1. For humans to enjoy their bodies and being close to others throughout their lives?
Mr. Chair, no, Mr. Chair. Again, these are reference materials, but these are not entirely adopted by DepEd po.
Yeah, but entirely DepEd. But how about the teacher?
These
Alam
are-
ba nila?
Yes, Mr. Chair, because these are not culturally appropriate for us.
Yeah, but
these
are the
materials.
teachers trained that these should not be used in the Philippines?
That should be part of their training, Mr.
But is
Mr.
it part
Chair.
of their... Ang tanong ko nga, na-train ba sila that they should be culturally sensitive and this type of material should not be taught in our classrooms?
That was emphasized in all the trainings, Mr.
Yeah,
Chair.
but the DO 31 calls for kindergarten all the way to grade 12. Nakita mo yung disconnect? Because I'm trying to understand the teacher. The teacher now is given leeway to use reference materials as what you said earlier. And part of the reference materials identified is the UNESCO Technical Guide, di ba? But UNESCO Technical Guide, ito ang gusto niyang ituro sa mga kindergarten students natin.
Mr. Chair, if I may add
Yeah,
to the
go ahead.
question of the chair, or rather, for the record, just more information about the UNESCO International Technical Guideline on Sexuality Education. It can be emphasized that the UNESCO document itself says that it is not a curriculum, nor does it provide detailed recommendations for operationalizing CSE at a country level. And further, it says that, quote, guidance is voluntary and non-mandatory and recognizes the diversity of national contexts in which sexuality education is taking place. This guideline is a framework based on international best practices intended to support curriculum developers, kayo po yun, to create and adapt curricula appropriate for local contexts and cultural values. So, ito po ba, the fact na voluntary and non-mandatory, the fact na recognizing the diversity of national contexts, na ituturo din po ba ng DepEd sa ating mga guro? Salamat, Mr. Chair.
Mr. Chair, yes. Again, that document, the UNESCO document, provides the framework for the implementation of a comprehensive sexuality education. But then again, we here at DepEd did not adopt it in its entirety. We use it as a basis for creating or crafting our own curriculum for CSE that is age appropriate, that is developmentally appropriate, and that's culturally sensitive po, which also covers, religious beliefs and other orientations.
Salamat, Mr. Chair.
Thank you. We understand that, of course, it's up to the teacher now, correct? To be culturally sensitive. So training is very important in that, and clarity from policy is very important. Because if you are confused from the top, rest assured that the teacher will also be confused. Because they're the ones tasked to implement all the way to our last classroom in our country. So that's why if you ask me my own personal opinion, if this is a source of confusion, then let's suspend it for now until we fix it and we make sure that it's clear from the policymakers, and stay faithful to the RH law. Because, like I said earlier, sabi nga ni Yusek, that is the legal basis, and let's stay faithful to that.
Mr. Chair.
Yeah, go ahead.
Mr. Chair, UNFPA is here. Maybe they can also speak to how their framework is harmonized to local contexts. Salamat, Mr. Chair.
We'll do the rounds, Senator Risa,
Thank you, Mr. Chair.
after we finish with our questions with DepEd. Yeah. There's also another, I'll point out, I saw this in the technical guide also, slide 56. Again, we'll flash it on the screen. Age 5 to 8. Key idea. Let's just zoom it. People can show love for other people through touching and intimacy. Learners will be able to state that people show love and care for other people in different ways, including kissing, hugging, touching, and sometimes through sexual behaviors. And these are being taught to our children, or at least a guide to our teachers to teach CSE. Ang aking concern is this might filter down to our classrooms. That is my concern. If you're saying that teachers know best, they are trained not to be discerning, then well and good. But I'm just flagging the DepEd that because it referenced to that UNESCO technical guide, and the teachers are given leeway to use references, including UNESCO, so what you said, Asek, then this will get filtered down to our teachers. That's what I'm trying, that is my point. No? That's why dapat very clear from the onset kung ano ba yung policy natin, ano ba yung legal basis natin. I was also looking at the materials. No, Senator Risa pointed out teacher training. Can you show us a department order or any instruction that implemented teacher training?
We have those documents, Your Honor.
Because we are
Mr. Chair.
trying to scan documents, hindi kami makahanap any documents that implemented a CSE training program.
We do have those
What-
documents.
what-
We will share it, Mr. Chair.
What department order is that?
Let me
Or
pull
what,
out that record.
What memo is that? And then can you give us an accomplishment report of that CSE training? Kasi yun ang punto ko lang eh. Baka yan pumabot yan sa mga classrooms natin eh. Yan ang punto ko lang eh. But if you're saying our teachers are not trained, our teachers are trained, and because of the training, they're discerning, they can discern what is culturally appropriate for the Philippines and not, then well and good. But I want to see an accomplishment report. Do you have an accomplishment report?
We have your, Mr. Chair. Allow me to pull it up. It's
Go ahead.
it's in a Google Drive.
While we're waiting, Senator Risa, if you, with your indulgence, we'll do the rounds, no?
Or if I may, Mr. Chair, just some follow-up questions
Yeah,
for
go ahead.
DepEd. Salamat po, Mr. Chair. Balik ako ng konti dun sa EO31 pa rin. The phrase school-age children is in section 11.01 of Rule 11 of the IRR of the RPRH law. So ito po ba ay basis din kaya ng EO31? Perhaps Yusek.
Yes,
Javier, Mr.
yes,
Chair.
yes, Madam Senator, when EO 31 was drafted or prepared, the law and the IRR themselves are referred to.
Salamat, Yusek, at salamat, Mr. Chair. Importante po yan. Importante na yung IRR ng RPRH law includes school-age children and has not been struck down as unconstitutional. So kahit inassail siya dun sa Imbong versus Ochoa, in effect, binalidate ng Korte Suprema. And last point po, at this point in time, Mr. Chair, gusto ko lang ulitin no, yung sinabi na po namin kanina, importante talaga makita, as in makita with our own eyes, makita ang aktual na curriculum ng DepEd para base sa aktual pa rin ang diskusyon natin. So, please kung maihanda nyo na, kung pwede nyong i-flash with the approval of the Chair. Salamat po,
Yes, Madam Senator.
Mr. Chair. Thank you.
Just to, Senator Risa, thank you for pointing out the IRR. In fact, Admittedly, there is inconsistency between the IRR and also EO12 that was issued during the last administration. Let me just flash um, the IRR. No, I think this is slide 51. And let me just read it. No? Section 11.01, age and development appropriate reproductive health education. The state shall provide age and development appropriate responsible parenthood and reproductive health education to adolescents and school-age children. We saw this, Senator Risa, and in my opinion, and to the lawyers in the room, not a lawyer, but the lawyers in the room can weigh on this, this constitutes ultra vires because it went beyond what the RH law calls for. And this is also one of the items that will be recommended to the DOH since they promulgated this RH law to stay faithful to the intention of the law, that the reproductive health education will only be implemented or only be taught to adolescents. This IRR, and we've seen this, Senator Risa, in many IRRs, no? They go beyond the intention of the law. They either go beyond or they don't go full on the intention of the law. That's why I ask Yusek, what is the law behind DO 31? Because we also saw the IRR had flaws in terms of the age qualification. No? So go,
Yeah, that is correct, Mr. Chair. That the law that we are implementing is RH law, and Department of Education saw that when they were preparing Department Order number 31. But Mr. Chair, as implemented, it is faithful to RH 31. Sexuality education proper is being taught to children ages 10 to 19 years old. Those subjects that are being taught to younger children, younger than 10 years old, are subjects or topics that would have been taught anyway, that should have been taught anyway, even without the CSE, Your Honors.
yeah, but in your DO, it's very clear, integrating comprehensive sexuality, letter E, integrating comprehensive sexuality education in K-12 curriculum.
Because the earlier part, Your Honor, is the foundational knowledge for...
Yeah, but it's not specific here.
That is why, Your Honor, we undertake to clarify
This
the matter.
implements CSE as a whole to K-12. It didn't make any qualification that adolescents will be CSE and age below 10 and below will be taught differently. Or
preparatory.
preparatory.
Yes,
There's no
Your Honor.
distinction here.
The distinction, Your Honor, is seen in the curriculum itself.
Yeah, but this is the guide to the curriculum.
When,
And this will be filtered. This is given to the curriculum and teaching group. This will be given to our regional directors, to our superintendents.
Your Honor, rest assured that when that document is given, they're also given the document with greater detail, that is the curriculum or the subject matter taught per grade level. So, Your Honor, as it is generally worded, and it may be a source of confusion, but any confusion can be clarified by the details, Your Honor, and the curriculum clarify any confusion that may be had because of the generally worded department order.
And I suggest you clarify it.
Yes,
But in
sir.
my opinion, if there's confusion, let's suspend it.
Mr. Chair,
Go ahead.
just to add to the points of the chair, may kopya po akong hawak, hard copy ng curricula ninyo from kinder all the way up to grade 12, I suppose. Yes po, senior high school. So, as I mentioned earlier, makakatulong during this hearing, maipakita nyo po sa ating lahat, sa komite at sa lahat ng resource persons, ano yung aktual na subjects na tinuturo sa kindergarten, sa grade 1, sa grade 2, sa grade 3, sa grade 4. No? I suppose yun yung grade levels na ages 5 to 9 or under yung 10 to 19 age range para makita po namin ano ba talaga ang tinuturo at ipinapaturo sa mga guro, ranging from identify the body parts and their functions sa kindergarten, na ilalarawan na ang bawat tao ay may iba't ibang uri ng katangiang pisikal sa grade 1, napahahalagahan ang pakikipagkapwa at pakikibahagi sa komunidad sa grade 2 hanggang naipamamalas ang pagiging isang aktibo at responsableng batang Pilipino, pagsasakatuparan ng panatang makabayan sa grade 3. Makakatulong po, just to flesh out yung sinasagot nyo sa amin, pakita nyo talaga yung subject matters talaga na tinuturo sa curricula ng bawat level na yon at age na yon under 10 years old.
Yes, Madam.
Salamat, Mr.
Yes,
Chair.
Madam Senator. We will, if you will allow Mr. Chair to circle back to us, we're just preparing the information.
Okay.
Thank
All
you,
right.
Mr. Chair.
With the indulgence of Senator Risa, we'll go back to you, DepEd. Let me just focus on, before we leave DepEd, no? I understand that you implemented a pilot launch of the CSE, Region 1, 7, and 11. Was there an impact study? What was the result of the pilot study? You do a pilot because you want to learn. Right? You want to understand what are the problems and then adjust accordingly before we go nationwide. So was there an impact study based on this pilot launching of the CSE?
There was a monitoring on the CSE implementation po in 2023, Mr. Chair.
Share with us the results of the findings. Anong results of the findings? And how did you adjust? Because I understand that CSE is now being implemented on a nationwide basis, correct? So before we implemented that, there were findings. So what are the findings?
Mr. Chair, may I read the conclusion of the report?
Correct, go ahead. This is based on the pilot, the 3 regions, no? Correct?
Let me verify, Mr. Chair. This is for regions 1, 5, 7, 8, and 11.
Okay. What are the findings and conclusions, and also ways forward?
The primary objective of the study was fulfilled by utilizing the online teacher survey that had been used in past studies and pilot testing school-based methods for in-depth information. The monitoring criteria were addressed by mixed methods. Addressing efficacy and sustainability seemed to be more related, while addressing relevance, effectiveness, and impact seemed to be more related. In the monitoring and evaluation criteria were to be simplified, these should have been taken into consideration. Best practices and initial recommendations are discussed in terms of sustainability and impact. Schools have started to implement CSE, but teachers need further support and experience. They need technical assistance in terms of training, materials, and resource persons. With the online trainings and cascading efforts, more teachers know what CSE is about. CSE-related trainings help teachers in their lesson planning and in building their confidence to deliver CSE. It should be noted that the teacher self-report in the online survey, such as middling self-efficacy ratings, do not necessarily match the high-performance ratings on delivery from observer reports, such as the CO ratings and exit survey responses. Individual variables from the teacher survey may be different from performance variables, which reinforces the need for various methods, both self and observer reports in a monitoring plan. Even with a short period of implementation, students have shown potential in achieving CSE outcomes through their positive feelings towards their classes and their attitudes alignment in most of the expected outcomes, including on the exit survey. They were also reflected in the modified FGDs of the learners. Further intervention should strengthen the desired qualities of CSE as a scientific, age and developmentally appropriate, culturally and gender responsive, human rights-based, and comprehensive. Future interventions can also aim to increase teachers' self-efficacy, awareness on and access to various resources, and availability of social encouragement to implement CSE. So it was generally positive, Mr. Chair.
What the challenge? Did you detect any challenges, and how did you correct those challenges?
The challenges mainly were in further support for the teachers moving forward, Mr. Chair.
Okay. We also saw some documents. I think this is one of the training materials that some of the, if I'm not mistaken, some of the I think it's supervisors who were trained. And here, one of the challenges, lack of knowledge, breadth, depth, and how. So in other words, they're still grasping for, here, no? Grasping for training and deeper knowledge on CSE. No? Was this addressed before you implemented this on a nationwide basis?
According to the implementing bureau, Mr. Chair, the concerns have been addressed by the bureau regarding the challenges that were presented.
Was that impact study or that report? We would like to understand how the DepEd addressed all of these challenges: no, lack of knowledge, teacher and school readiness, cultural constraint, which is a very sensitive matter, parental participation and readiness, and perception and misconception. Were all of these challenges addressed before going nationwide?
According to a report by the bureau, Mr. Chair, these have been addressed. We'll revert to you po. I will just talk to the Bureau of Curriculum Development and the Bureau of Learning Delivery regarding the implementation of this program po.
All right, sige.
Mr. Chair, if
Yeah.
I may add. Salamat, Mr. Chair. Just additional information from similar studies as the Chair mentioned. For example, a 2020 report on a baseline assessment of teachers' capacity on CSE from select regions showed that teachers still need to be more aware of the details of the program, how to implement it, and where and how to get resources. Although this was half a decade ago, pero interesado ang komite. How have you progressed or not, the department, no, since then? At that time, around 65% of teachers interviewed were aware that CSE is one of DepEd's priority agenda, but less than half had access to the official DepEd policy on CSE. 49% of them at that time felt they had inadequate training in order to implement CSE effectively, but majority, more than 90% of the teachers interviewed were supportive of DepEd CSE program and agreed that it should be part of the K-12 curricula. So may suporta, but they themselves expressed they needed to be capacitated. So yung follow-up question ko lang po, kaugnay niyan, Mr. Chair, ano pang suporta ang kailangan ng DepEd para sa epektibong rollout ng edukasyon sa sexual and reproductive health, Mr. Chair?
Go ahead, Asek.
I suppose, Mr. Chair, based on the reports and also on the report I read earlier, it's really more on the teacher support for resources and materials, and perhaps a more in-depth training for them to be able to implement this properly. And as Yusek Javier mentioned earlier, we are on the process of reviewing the DO and also aligning our programs to further support the DO in its implementation po.
Salamat, Mr. Chair.
Is CSE part of the pre-service training of teachers?
In-service
Sa
po.
pre-service.
I am not sure, Mr.
Are you a
Chair.
teacher, Asek? Hindi ka, nag-teacher ka ba?
Sa higher education po, sir.
Higher
Mr. Chair.
education. Because I understand, again, I ask our teachers, to all the teachers here in the room, comprehensive sexuality education is never taught during the pre-service. In other words, they're never taught CSE in college. So the only way for them to be trained is in service, pag nagtuturo na sila. Correct? And we all know how difficult it is to train teachers during in service, no? Because we have to pull them out of their classrooms, no? Having said that, from Senator Risa's manifestation earlier, that teachers need more training. In other words, that's the bottom line. No? For a sensitive topic like this, that is not taught during the pre-service period, the pre-service level, then in-service training is a very important component to make sure that CSE is implemented properly, no? And our teachers know what to do. No? That's the bottom line.
I agree, Mr. Chair.
With that, before we go back to DepEd on that on the curriculum, because I'm also very interested with that, we'll call on our other resource persons. DOH, any comment from the DOH? Yes, Asek Domingo.
Thank you, Mr. Chair. Maraming salamat po sa lahat ng ating mga senador at mga kapwa resource persons. Ang datos po natin, nakikita pa rin natin na yung adolescent birth rate, kung ilan ang bata na ipinanganganak sa nanay na 15 to 19 years old. Noong 2020, ito po ay nasa 24 per 100,000, or in real numbers, actual numbers, 121,896. Noong 2021, nasa 22 per 100,000 or 112,990. Noong 2022, nasa 24 per 100,000 o 123,362. Tapos noong 2023 po, nasa 25, tumaas, 25 per 100,000 live births or 132,157. Bakit po ito nakakabahala, Mr. Chair? Kapag ang ating nanay po ay nasa adolescent age, una po ang kanyang pangangatawan ay hindi pa handa physically, medically para magdala ng bata. Hindi po yan ang angkop na edad para sa matres at para na rin sa kanyang hormonal makeup para magkaroon ng anak. Ikalawa po is yung tinatawag na health-seeking behavior. Sa health-seeking behavior, gusto po natin na meron tayong antenatal check-ups. Ideally, 4 bago siya manganak, dahil sa check-up na ito nalalaman kung kamusta hindi lamang si baby, ngunit pati si mommy. Kasi ang mangyayari po kapag hindi maganda ang kanyang kalusugan at ang kalusugan ng kanyang sanggol ay pag siya po ay nanganak, nagiging maternal mortality. Which brings me, Mr. Chair, to the point on maternal mortality ratio. Ang atin pong maternal mortality ay pinakamababa noong 2019, in recent years, nasa 87 per 100,000. Pero sumirit po siya papunta sa 182 per 100,000 noong 2021. Bahagyang bumaba noong 2022, naging 138 per 100,000. Pero malayong-malayo po yan. Sa ngayon po, nasa panahon na tayo ng Sustainable Development Goals. Yung previous set of goals po, Millennium Development Goals, kung di po nagkakamali from memory, the target was nasa 50 per 100,000 or thereabouts. Malayo po yung 138. At dahil po dyan, Mr. Chair, i-connect ko na rin po, it was also part of the agenda forwarded to us, yung HIV epidemic. Ito rin po ay pertinent dahil ang isa pong, hindi lang pala isa, ang pinakamataas na mode of transmission ng ating HIV ay ang sexual transmission sa pakikipagtalik. Sa ating datos po sa HIV/AIDS, up to 47% of new infections are from the young key populations na nasa edad 15 hanggang 24. Ang kwento po nito, Mr. Chair, yun pong ating mga kabataan na maagang makipagtalik ay mas mataas ang risky behavior at mas nahihirapan na kumuha ng mga HIV-related services. Makikita po sa datos natin na on average, yung ating pong mga young key populations for HIV, sila po ay nakipagtalik nung sila ay 16 years old. At una po silang gumamit ng condom on average nung sila po ay nasa 17 years old. Kung bakit po, yun po yung mga kailangan natin tingnan. At sa aming pakiwari ay baka yung impormasyon or yung commodity, yung condom mismo ay hindi nakarating sa kanila nung panahon na sila mismo ay nagsimula na sa pakikipagtalik based on our data. Having said that, Mr. Chair, nakikita natin na malaking bagay yung usapin na dito. The bill, which we are also aware is being considered, yung ating pong substitute to SB 1979, the framing of the latest version is a national policy in preventing adolescent pregnancies. Even though it focuses, Mr. Chair, on adolescent pregnancies, it also touches on other disease and health conditions like we mentioned HIV, because the very same act which we hold so dear and so sacred in our culture has to also be guided by scientific information and means to carry it out in a healthy way possible. And in that case po, marami po tayong masosolusyonan, hindi lamang yung, ang sabi nga ho ni Secretary Arbosa, dapat hindi yan tinatawag na teenage pregnancy, childhood pregnancy yan eh. Kasi nagiging hang up tayo dun sa 13 hanggang 19. Para bang nagiging legitimate siya. We're not saying it is legitimate, pero na-normalize na pag teenage na bubuntis. Dapat gulatin natin ang ating bansa. Hindi dapat nabubuntis ang bata. Ang bata ay dapat nag-aaral, ang bata ay dapat lumalaki at pinopursue niya yung kanyang mga pangarap sa buhay. Hindi siya dapat nagdadala ng isa pang bata. Which, by the way, to our understanding, we're not lawyers, but if it's 16 or below 16, it is statutory rape. So meron talagang maling nangyayari na parang whether it is a lack of information or a lack of access to the commodities or with due respect to our counterpart agencies, a lack of enforcement, the fact remains that childhood pregnancies are high, maternal mortalities are high, and many new cases of HIV are because of the young key populations. Thank you, Mr. Chair.
Thank you, Yusek Domingo. We'll call on Commission on Population Development.
Or Mr. Chair, time na ba makapagtanong sa DOH?
Yeah, we can pound some questions.
Salamat, Mr. Chair. Just a few initially kay Yusek Domingo. Doctor, a CSO in Puerto Princesa, Palawan, Roots of Health, has taught over 100,000 students and trained about 6,500 teachers in CSE for the past 15 years. Puerto Princesa is the lone city in the Mimaropa region that bucked the trend of rising adolescent pregnancy. So, masasabi po ba natin na yung CSE ay gumanap ng malaking papel sa pagpapababa ng teenage pregnancy sa syudad, Mr. Chair?
Thank you, Mr. Chair. Una po for the record, it's Assistant Secretary, hindi po Yusek.
Sorry.
Baka mapagalitan po ako ng ibang execom. But having said that, Mr. Chair, Senator, actually nakikinig kami kanina sa usapin po dun sa curriculum. At baka luma lang po yung nakuha ko, but it might be pertinent kasi historic po yung data sa Puerto Princesa. Yung nakuha po namin is the August 2016 K-12 Curriculum Guide. And I think in support of our colleagues from DepEd, malinaw nung napilitan na rin po kaming magpanggap na teacher. Hindi, kasi gusto natin pababain yung teenage and childhood pregnancies eh. So tinignan namin with age equivalence, doon sa grade 5, Mr. Chair, if DepEd, correct me if I'm saying it wrong, but to my understanding as a non-DepEd, non-teacher, the mention of puberty begins, at least in the 2016 curriculum version, at the age of 11, which is grade 6. In the second quarter, you will have a subject on puberty at ang pinag-uusapan nila, and also for the record, I'm flipping to the very thick, nagpaspasan ho kaming basa. Pero dun sa grade 6, no, malinaw, I correct myself, grade 5 po pala, grade 5, which is 10 years old. On page 48 of the 95-page document, nakalagay, changes during puberty, physical changes, sexual characteristics, hair growth, voice change, breast development. And then, pagdating ng grade 8, sa first quarter, Family Health 1, yung subject, doon pa lang ho papasok yung mas detailed. And what is the age of grade 8? Nasa 13 years old po yan, 13 anyos. Pinag-uusapan na yung gender and human sexuality in the document of DepEd itself, and which we support, correlate with values education, coordinate with guidance counselor. Nakasulat yung learning competencies, identify basic terms in sexuality, discuss sexuality as an important component, but more importantly, Mr. Chair, flipping through the same document, pag umabante tayo sa bandang second quarter ng grade 8, pag-uusapan na yung responsible parenthood. Kasama sa learning competency would be the importance of responsible parenthood and enumeration of the modern family planning methods, natural and artificial. So yan po yung nakita namin, and we tried going also back, I was listening intently, Mr. Chair, and we fully support no, na parang ang sinabi ng RA 10354 is adolescent. So, nagkalkal po ako personally dito sa curriculum. Wala naman pong nakitang mention on the sexuality below the age of 10 insofar as this version of the curriculum is concerned. Ang pinaka-earliest mention lang po was nung grade 2, which is 7 years old. Yung family health sa third quarter, meron siyang curriculum learning competencies on expression of feelings. But even the wording does not refer to any sexuality. It just mentions na para bang ina-acknowledge niya na para sa isang tao, normal na magkaroon ng feelings towards each other. So yun po yung nakita po namin sa 2016 version, which we think connected to the question of the Honorable Ontiveros is germane kung bakit dun sa Puerto Princesa, if they were actually using this version as we appreciate it, then it is reasonable to argue na it is compliant with the law, 1054, section 14, and also napababa nga nila yung ating childhood pregnancies.
Salamat po, Mr. Chair at Dr. Domingo. And hari nawa nga no, na yung reduction of teenage pregnancy sa Puerto Princesa ay matitrace din in a significant way dun sa compliant na pagpapatupad ng CSE, ng Roots of Health, ayon dito sa curriculum ng DepEd. Dahil talagang kinikilala na hindi lang dito sa ating bansa, sa ating rehiyon, in many countries all over the world, Singapore, Estonia, UK, etc., etc., na yung CSE ay documented over at least the past 3 decades na epektibo sa pag-prevent at pagpapababa sa rates of teenage pregnancy. Now, just a couple of more questions for DepEd at this point, the DOH, if I may, Mr. Chair. So the RPRH law requires also the DOH to submit annual reports on the status of its implementation. Ano po yung findings sa latest report ninyo? Kumusta po ang implementation? Di lang po in terms ng outputs, pero pati po sa outcomes, Mr. Chair.
Thank you, Mr. Chair. We will submit a copy of the implementation report, but from memory, yung general themes po niya, and based also on the data, hindi pa natin nararating yung ating mga gusto. In particular, for example, the unmet need for modern family planning is still quite high. Paliwanag po natin, Mr. Chair, Honorable Senator Risa, sa ating mga kababayan, pag sinabi pong unmet need for modern family planning, hindi po yan modern artificial lang. Meron rin pong modern natural, which is culturally and religiously compliant depending on who the provider is discussing. So it involves all scientific, natural, and artificial methods. And yun pong ating modern family planning rates, hindi pa ho siya dun sa gusto natin. Right now, yung unmet need for modern family planning 2023, this is only unmet need, and this is only medyo data po, no? Kasi pag sinabi naming Field Health Service Information System, nakakapture lamang namin yung sa mga RHU, sa mga public system. Hindi namin nakakapture yung mga private na gustong magkaroon ng ating calendar method, or rhythm method, or condom, or long-acting method. Hindi nakaka-capture. Kaya pag sinabi ko yung number, wag po natin i-quote sa media na mababa kasi sasabihin ko 2.98% in the public sector. Repeat, in the public sector. Hindi po namin nakaka-capture yung mga pumupunta sa butika, sa mga planetary butika, hindi ko sasabihin yung brand, na doon sila bibili kasi hindi po papasok yung data dito.
Understood po, Mr. Chair. And lastly, for DOH at this point in time, and then if later on you can submit further to the committee through the chair, yung outcomes po. Oo, hindi lang outputs pero yung outcomes. Opo. Nung na lumabas sa latest report nyo sa RPRH implementation. Ano po yung top indicators na ambag sa adolescent pregnancy? At anong interventions ang na-introduce na ng DOH o planong i-introduce ng department para tugunan or at least i-address itong mga factors na ito, Mr. Chair?
Yes, Mr. Chair. Yung mga factors po dito is yung health-seeking behavior ang pinakamalaki. Pwede kasing pre-pregnancy, during pregnancy, and post-pregnancy. Pag sinabi po nating pre-pregnancy, yung kaalaman ng ating kabataan, ano ba ang mekanismo ng reproduction? Importante yan dahil kung alam nila, then mas maaalagaan nila, mas makakalapit sila sa kanilang pastor or sa kanilang guro or sa kanilang kamag-anak na pinagkakatiwalaan para makakuha ng tamang impormasyon at hindi pupunta sa TikTok or kung saang-saang social media at kung ano yung makita doon, ganito pala ang nangyayari. Tapos magugulat na lang sila after that pre-pregnancy act na pupunta sila sa pregnancy. So pagpunta naman sa pregnancy, ano yung health-seeking behaviors ang gusto nating malaman? Gusto nating maintindihan nila. Gusto nating maintindihan ng ating kabataan na ang pagdadalang tao ay isang sagradong function, no? Whether you look at it both from the religious or also the medical. We hold it as sacred because no one giving birth should actually die. Yan yung, hindi ko lang nasabi exact quote but it's an old, often repeated, still valid quote na sa Tagalog, pag nagpapaanak ka, nagbibigay buhay ka, hindi ka dapat mamamatay. I'm referring to maternal mortality, which is why during pregnancy, dapat yung health-seeking behavior, nagpapacheck up sila, malalaman ano bang gagamit ng Leopold's maneuver, malalaman ano ba yung fetal position, naka-breach ka ba, nakatama ka ba, tama ba yung birth weight estimated for the staging, etc. etc. Ikaw ba ay tawag dito? Yung placenta mo ba ay nasa tamang lugar? Baka may placenta previa ka or others. Bigla ko na pa-review ng OB. Anyway, having after pregnancy, post-pregnancy, kapag nanganak na po, may mga bagay tulad ng baka nagkaroon siya ng gestational diabetes mellitus or gestational hypertension or baka nagkaroon siya ng postpartum depression, which is a mental health condition na biologically linked to the child-carrying condition of pregnancy na maaaring hindi kaya ng ating mga batang magulang. So yun po yung mga health-seeking behaviors overview po, Mr. Chair, Honorable Ontiveros, na gusto nating sanang maparating ng tama dun sa ating kabataan. To begin with kasi, we still maintain the position, hindi sila dapat nabubuntis. Dahil hindi nila physically para bang capability, hindi nila kakayahan ng katawan nila na mabuntis. Ang maganda ho talaga sa kanila at ikaw connect ko sa national development is mag-aral muna. Hindi lang to dahil bilang, I'm starting to sound like my mom, mag-aral ka muna. Pero there is actually an economic reason and also a health reason dahil kapag nag-aral po sila, mas nagde-develop yung kanilang katawan, mas nagiging productive members sila. Later on, ang singil nila sa PhilHealth ay bababa. Bakit? Kasi alam nila yung tamang health-seeking behaviors. Alam nila kung paano maging malusog na pamilya. So it's all interconnected, Mr. Chair. Thank you po.
Thank you also, ASEC, at salamat po, Mr. Chair. Napakahalaga po ng mga ibinahagi so far at bukod sa health-seeking behaviors, including saan ba sila humihingi at nakakatanggap ng kaalaman tungkol sa pag-iwas sa teenage pregnancy, tungkol sa pag-alaga sa kanilang pangkalahatang kalusugan. Salamat sa pagbanggit sa social media. Dahil bukod sa larangan din yan na dapat sana daluyan ng tamang impormasyon para umiwas sa teenage pregnancy or kahit sa CSE, higit na mas mabuti kung tayo mga magulang at guardians, kung ang mga partner nating mga guro ang gumagabay sa ating mga kabataan. Hindi yung dun lamang sa social media na hindi sigurado na mayroong caring adult supervision or guidance or support. At hindi din lamang sa kanilang mga kababata who may be acting in good faith pero maaring kulang din or walang or baka maling impormasyon. So mas maigi na through CSE, DepEd and DOH in partnership with the families. And last but not the least at this point, Mr. Chair, salamat din po sa pagbanggit ng economic dimension ng teenage pregnancy dahil talagang kapag hindi natin natulungan yung mga anak natin at yung mga estudyante natin at mga community youth natin na umiwas sa teenage pregnancy o pag hindi natin natulungan yung mga nabuntis na at nanganak na tumindig ulit at itindig ulit yung sarili nila at yung kanilang mga babies, talagang nagpapatuloy yung sinasabing intergenerational na kahirapan, yung kawalan ng kakayahan na magtapos sa pag-aaral, kawalan ng kakayahan na makahanap ng disenteng trabaho at hanap buhay, and therefore kawalan ng kakayahan na itaguyod ang sariling pamilya ng maayos sa tamang panahon. So maraming salamat po para dun sa pagbibigay din dun sa economic, dagdag sa health aspects ng teenage pregnancy. Salamat po, Mr. Chair.
Thank you, Senator Risa, for those very good interventions and questions. Sa DOH, I was going to ask this together with DOH and the Population Commission, but I'll ask it now. Maybe it's relevant to DOH. I showed this earlier, the historical number of adolescent mothers. In 2012, it was about 209,000, and now it went down to 142,000. Of course, on its face value, it looks like it's quite positive, no? But 142,000 of pregnant teens is still 142,000. No? Looking at the timeline, the CSE was implemented on a pilot basis in 2021. The full rollout is school year 2022-2023. So, based on your analysis, ano nangyari? Bakit there was a gradual decline in terms of teenage pregnancies outside of the CSE or outside of the reproductive health education? I want to understand what is the country doing? No? Why this is, or maybe we're not doing anything intentional, but the society is doing something. So based on your analysis, what happened? Why there was a slow decline of teenage pregnancies?
Thank you, Mr. Chair. Let me just dispose of that very obvious white gap from 2020 to 2021. May ginawa po tayo, linockdown natin lahat. Kaya hindi sila nakipagkita. I mean, that's the simple explanation. A lot of things in health can be positively or negatively interpreted because of the pandemic. So, having disposed of that, Mr. Chair, 2013 ang taon kung kailan naging batas ang RA 10354, ang Reproductive Health Law or ang RPRH Law, Responsible Parenthood and Reproductive Health Law. Nagkaroon lang po siya ng slight implementation delay pagdating dun sa pagbigay ng commodities dahil nagkaroon nga tayo ng kaso ng Imbong versus Ochoa na ang ruling naman ng Supreme Court is the petitions are partially granted. The court declares RA 10354 as not unconstitutional except with respect to the following provisions which are declared unconstitutional. At nung dineklara ho ng Supreme Court, nagkaroon siya ng specific enumeration. Hindi naman po na-touch yung section 14, which is yun sa ating age and culturally appropriate education. Sinasabi po namin ito, Mr. Chair, dahil bagamat by name, comprehensive sexuality education may have manifested in 2021, if we look at the reproductive health law, section 14, hindi siya, kaya ako nagsuslow down kasi baka makuryente ako sa sasabihin ko, hindi siya identified as comprehensive sexuality education dun sa lengguwahe ng batas. Pero yung elemento, and as I demonstrated, Mr. Chair, kanina, yung 2016 curriculum ng DepEd, which came after the RH law was legislated, it is actually the manifestation already of Section 14, at least in the year 2016. And going back to the data, we can see now na meron kami tinatawag na time lag of implementation. This is very interesting and the epidemiologist in me is geeking out kasi para siyang epidemic curve. Ibig sabihin po, titignan natin dun sa time series kailan tayo nag-intervene. Kung ang tool na ginamit namin sa public health is yung RPRH law 2013, we don't expect na makikita natin sa datos. In fact, tumaas pa nga noong 2014 ng bahagya. Pero dahil nga lumabas na yung Imbong versus Ochoa with finality thereabouts 2014-2015, we can argue, and this is the hypothesis kasi in epidemiology, maraming pwedeng dahilan niya. So, nagsimula na siyang bumaba, 15, 16, 17, 18, 19. Actually, consistent yung trend. Nakakapagtaka lang, bakit noong 2022 biglang pumanik siya? I don't have a ready answer right now, Mr. Chair, no? Kasi that is like, could be an artifact. Ano kaya nangyari nung 2021 to 2022? Okay. I was about to say, nag-open up kasi, parang yung mga paputok yan eh. O, sinabi ko, paputok ha. Factually, mga fireworks. Wala akong ibang paputok na ina-allude. Having said that, ang paputok, tumaas yung mga injuries noong 2022 kasi literally bumukas ang ekonomiya, nagsibilihan ng fireworks. So a lot of things health-wise can also be traced to the closure of the country and its reopening. Yun lang po ang explanation doon sa bakit pumanik from 11.1 to 11.5 noong 2021 to 2022. Thank you, Mr. Chair.
Thank you. So the pandemic contributed to the reduction, but in fairness naman to the RH law, there was a gradual reduction. I'll go to the other slide, slide 3. If you look at the growth trend, there was a gradual decline starting 2015, diba? But you're right, no? In 2020, 2021, those are the pandemic years, and because of no interaction, it spiked. No? But in fairness naman, before pre-pandemic levels, it was going down. But in the same token, we also saw that pregnancies from age 10 to 14, and page 4, is also increasing. No? And this is worrisome, no? Because we're talking about age to 14. No? So what is your analysis on this, this trend?
Thank you, Mr. Chair. This is actually consistent, and I will echo using data from Popcom na overall, nakita natin sa nakaraang slide sa bumababa nga siya, pero pagka nag-disaggregate tayo by age group, yung 10 to 14 tumataas. So ano pong ibig sabihin nun? And I will correlate it with our data on HIV. Ang ating, at least dun sa young key populations sa HIV, ang kanilang unang pagtatalik, first sexual contact is at the age of 16. Pero ang kanilang first age of use of a contraceptive or a condom is age 17. Which means, unang nag-activate yung kanilang katawan, meaning it's a hormonal, I can speak about it scientifically, it's a hormonal urge. They don't understand probably kung anong mangyayari. They have sex. And then when they realize na meron palang contraceptives, 1 year late na siya, merong lag. Now, correlating it to the data, Mr. Chair, bakit yung 10 to 14 yung tumataas? Because that is much earlier than 16 years old. If you look at the curriculum of DepEd, insofar as the age is concerned, pagdating nila ng 16 years old, grade ano na yun, 10 na yun, papasok na sila ng senior high. And the question is, at least based on the 2016 curriculum, sapat ba na inintroduce na natin sa 11 years old yung mga lessons on puberty? Or this is a question which our colleagues from DepEd probably, together with us, would be better to answer. Dapat ba nating agahan na? Hindi ko natin sinasabi na yun ang posisyon ng DOH, pero the data is just telling us 10 to 14 yung pumapanik yung childhood pregnancy, kaya nga tinawag na childhood Therefore, should we use age-appropriate and culturally sensitive information na i-deliver natin at a slightly earlier age? We're not saying don't give it to kindergarteners. But probably, let's look at 9 or 8 years old. Kasi kung dumadating sa 11 years old yung impormasyon at nakikita natin na nakikipagtalik na sila from 10 to 14, baka kailangan maabisuhan na sila na mas maaga. Thank you, Mr. Chair.
Yung pamangkin ko, 10 years old, nag-aaral pa lang mag-basketball Kaya medyo, this is worrisome actually, that as early as 10 years old, we are seeing teenage, actually hindi pa siya pregnancies or childhood pregnancies. All right, we'll call on Commission on Population and Development, Deputy Executive Director Takardon.
Thank you, Mr. Chair. Siguro to contribute din po doon sa discussion with the DOH and in terms of why gradual yung decline ng 10 to 14. May I highlight din po some information that also come from the same source, yung Civil Registry and Vital Statistics po ng PSA. In addition doon sa tumataas nga na live births among 10 to 14. Actually, ang nakakalungkot po, in 2023, meron pong nai-register na live births younger than 10, 8 years old in Sulu. No? So ito po kasi sa Civil Registry and Vital Statistics, these are registered live births. So baka meron pa pong hindi registered na nare-report. So underreported po to. So yan ang medyo nakakalungkot po. pag itataas po natin yung disaggregation by age ng 10 to 15, actually, the issue becomes more significant because we have 11,479 live births among aged 15 and below, which is actually below the age of sexual consent. So sila yung vulnerable sa mga sexual abuse. And in fact, meron pong indication na nangyayari nga po yun. In general po, sa mga minors, 17 and below, we have 54,510 live births. Registered lang po to. And ang medyo nakakalungkot din po, hindi lang once, but we also have cases of repeat pregnancies. And we have 23,267 live births which are considered as repeat pregnancies. So hindi first time, although karamihan first time. And among minors po, we have 4,220 na repeat pregnancies. No, so hindi lang siya una, but ulit-ulit po na births. And there are some indications, especially doon sa question of bakit nangyayari po ito. Also in the Civil Registry of Vital Statistics, we have the PSA recorded that the age of the live births ng father ng mga to ay 20 years old and older, karamihan. No, so there's really an indication of sexual abuse, kaya medyo talagang kailangan po talagang tignan din po ito, no, yung strengthening the mechanisms for the prevention of sexual abuse. And of course, the CRVS cannot tell us kung sino-sino po yung characteristics ng mga bata na nabubuntis, pero the National Demographic Health Survey is telling us that the tendency of women with lower wealth, with lower education and those belonging to the poor ay mataas po yung mga unplanned pregnancies sa kanila. So may socio-economic dimension po yun. Kaya po, we consider that the issue of adolescent pregnancy is really a complex phenomenon. That's why the Commission on Population and Development has initiated po yung development of a comprehensive action plan for the prevention of adolescent pregnancy in collaboration with other relevant agencies. And we identified 5 critical areas na dapat may intervention. Siyempre, una na po yan yung pinag-uusapan po natin ngayon na comprehensive sexual education, reproductive health education. Pero ang suporta pong binibigay naman ng Commission on Population Development po sa DepEd ay yung pag-training po sa mga magulang. So yun po ang focus po namin. And sa mga kabataan po na out-of-school youth din, community-based interventions. Pero ang focus po ng aming mga modules ay life skills-based education, which is training them, for example, on planning their lives, life planning and visioning, critical thinking and decision-making, refusal skills, even healthy lifestyle, and yung pong responsible sexuality. No, yung po yung content of our curriculum. And we also train po yung mga other adults who have significant influence over the behavior of young adolescents, particularly mga service providers, mga barangay tanos din po, and mga barangay officials, kasi meron din pong mga barangay policies that contribute din po doon sa pag-deter ng adolescent pregnancies, such as the curfew. No, pero we hear reports of yung mga mismanagement po ng mga ganong klase, kaya kailangan din po silang matrain. And also improving yung access ng mga kabataan dun sa appropriate reproductive health services. That's why lalo na po sa mga adolescent mothers, no, para mapigilan po yung mga repeat pregnancies po na yon. And establishment po ng mga facilities where young people can easily access, because as mentioned po ni Asek Domingo, no, yung health-seeking behavior is really a problem among young people. So ang aming pong pinupush in relation po sa DLG is yung establishment of adolescent and youth-friendly health facilities and teen centers. Another po is yung nabanggit po kanina, strengthening the mechanism to protect sexual abuse. Also addressing the socioeconomic dimensions and institutionalized social protection programs, especially for adolescent mothers and their children. And lastly, yung pag-divert ng positive energy of young people towards positive contribution sa community development in nation building. So that's where the role of SK ay in-encourage po talaga. So we from the Commission on Population, we believe that the teenage pregnancy should be approached in a more comprehensive way. Thank you, Mr. Chair.
Deputy Executive Director, you mentioned you have an action plan
Yes.
What are those 5 components of that action plan? You mentioned CSE/RHE, and then what are the other?
Improving the access of adolescents to appropriate reproductive health and social services. Strengthening mechanism po to protect sexual abuse and exploitation. Another is addressing socioeconomic dimensions and institutionalized social protection for adolescent mothers and their family. And lastly po, promote positive adolescent development and their participation in nation building.
Please submit to us na lang yung action plan so we can take a look at that.
Yes, Mr. Chair.
We call on DSWD, Yusek Di Maporo.
Yes, Mr. Chair. The Department of Social Welfare and Development recognizes the urgency to address rising adolescent pregnancy and human immunodeficiency virus among youth and its impact on the national development with age-appropriate and culturally sensitive reproductive health education. In its mandate to formulate, implement, and coordinate social welfare and development policies for and with the vulnerable, such as youth, young adults, and pregnant adolescents, the DSWD offers 2 main programs. The Pantawid Pamilyang Pilipino program, 4Ps, requires participation in family development sessions, reinforcing the family unit as the primary social fabric essential for providing protection and nurturing the growth and development of young household members, respecting the rights of parents and guardians to ensure the religious and moral education of their children in conformity with their own convictions. In addition, the 4Ps conducts youth development sessions, or YDS, designed to foster a positive mindset among young participants, guiding them in a multitude of matters that youth face. The YDS addresses the developmental needs of adolescents by helping them navigate the challenges they encounter during various life stages. While sexual education may enable youth to make informed decisions with regard to their reproductive health, it is imperative that we invest the same energy and vigor in promoting education and vocational training that can give youth the tools with which to fight poverty and unemployment. The DSWD lauds the initiative to review the effectiveness of the existing comprehensive sexuality education policy and explores measures to direct Filipino youth to become independent and economically productive members of our society. To contribute to Executive Order Number 141, the DSWD is implementing the Protecteen project in partnership with local population and development offices, which aims to provide comprehensive support to children or adolescent mothers by addressing their social, economic, and health needs. Protecteen supports the Social Protection Program for Adolescent Mothers and Their Children, or SPP-AMC, particularly in the provision of social assistance and social welfare services. The DSWD advocates the potential for successful, healthy growth and development of young adolescents and their valuable role in Filipino society. We support educational experiences that are informative, culturally sensitive, age-appropriate, in a learning environment where children and youth can grow and thrive in harmony with their cultural identity. Thank you, Mr. Chairman.
Thank you. Thank you, Yusek. Well, there's I think we all agree that the role of the parents is very important in making sure that their children are reared properly and also grows up in an environment where there's understanding and respect. And we also need to emphasize the role of the parents in the delivery of reproductive health education to their children, as well as sex education to their children. There's a law that was implemented a few years back. This is Republic Act number 11908. And this is the Parent Effectiveness Service Program, which the DSWD is the primary agency to implement this. And the direction of this law is to empower our parents, making sure that they're also active participants in the rearing of their children. This law also empowers local government units, or mobilizes local government units to organize and to make sure that our parents are involved in the education of their children. So may I know the status of this law? Because what I hear from our resource persons, addressing teenage pregnancies and other societal issue cannot be the sole responsibility of government. You know? It cannot be just relied on comprehensive sexuality education or reproductive health education. It has to also focus on the parents, getting the parents more involved, not just meeting them once a year, but really mobilizing them to educate their children. So, may I know the status on the status of the implementation of the Parent Effectiveness Service Program?
We implement parent effectiveness through the family development sessions of the 4Ps and developed resources in the forms of manuals and modules. There are three main manuals that we use in the subject matter of adolescent pregnancy, and that's Parent and Adolescent Manual, which delves into the relationship between the parents and the adolescents and the different life stages that the adolescents have to go through. And there's also a module on teenage pregnancy and early parenting. And finally, the third module is child sexual abuse prevention modules for children, youth, and parents. And all municipal links or our social welfares all across the nation, 10,510 of them are well trained for this. Allow me to also share statistics. We have a total of, from as provided by law, the age of 10 to 19, we have a total of 7,268,113 and 113 adolescents from age to 19. And within the 4Ps, what's captured as reported pregnancy or reported marriage adolescents na rin, the total is only 86,330 compared to the 7 million plus. And that's barely 1% of the 4Ps population. So we can say that the family development sessions and the youth development sessions have been rendered effective in terms of curbing pregnancy in the 4Ps.
It's among the 4Ps, and like what the Commission on Population mentioned earlier, there's also a socio-economic dimension in teenage pregnancies. The poor, actually I have a slide on that, the poor, we see a bigger incidence of teenage pregnancies among the poor. No? Ano yun? The 12 there. No? So the poorest have 47% probability of being pregnant at adolescent age. No? So the 4Ps is a good start. No? But we're talking about more than 4Ps. No? We're talking about the entire public school system. No? So, and the PS calls for the local government units organizing PS programs on the ground, and the SWD monitors those implementation, of course coming up with standard modules. So outside of the 4Ps, have you already started mobilizing the old LGUs to organize parents through the PS law?
We have the Protectin that's outside of the 4Ps, the Protectin project in partnership with the LGUs. However, it's very limited. The reach of the DSWD is very limited due to funding constraints. In 2002, for example, the actual number of beneficiaries that we reached out to are only 70. In 2023, that ballooned to 520. And 2022 to 2013, these were only the pilot stages in only Region 4A and Region 10, and just a few municipalities within that region. The types of interventions that we provide them is not necessarily CSE, because we try to reach out and coordinate with DepEd, CPD, and also with DOH. However, there's always room for improvement. We probably need better coordination between the different agencies. But we do have manuals that focus more on psychosocial intervention. So when the teenage mother is ready, then we undergo a number of interventions with the teenage mother. Part of this is education, livelihood, but the biggest part of it is really self-awareness and accepting of the self, and mainly psychosocial interventions. We have a manual for this as well. So we involve not just the parent, but also the community. So we have a module that that follows this social welfare model of intervention.
500, we're talking about you
Yes.
said 500 parents?
Well, 520 teenage mothers.
These are teenage
Mothers,
mothers. No, but
yes.
how about parents?
The parents are involved in the interventions as well.
But we need to be proactive.
Yes,
Not
yes.
These are already parents of teenagers who are pregnant.
Yes.
No, so we need to be proactive. We need to stay ahead of the curve. So may I suggest to work with DepEd, because DepEd organizes the PTAs, no? And this is already a good start to launch the PES program. So may I suggest to work with DepEd, because the infrastructure of the PTA is already there.
Yes.
So it's just a matter of inserting the modules that you have developed under the law. And I really believe that this is another way of curbing teenage pregnancies, when we mobilize the parents, making them aware of this issue, and also empowering them, educating them on how to talk to their kids. No? This is very important. It's part of the law, actually. So I urge the SWD and DepEd to work together in order to increase the reach of the PES program.
Yes, Mr. Chair.
Thank you. We call on the ALG. Any comments?
Mr. Chair,
Yeah,
before
go
we
ahead.
leave
Yeah.
DSWD, just a few more bits of information highlighting yung how much more we parents and guardians have to get involved. There was a study that only 12.5% of youth have ever experienced talking about sex at home. So we want to increase those conversations at home, especially with the parents and guardians. That was a decline from the 16%, although way back in 1994, but an increase from the 10% in 2013. That year, 2013, a UP Population Institute presentation reported that 2 out of 3 parents agree that CSE should be taught at school. So there's also, like the data presented by DepEd of the teachers, there's support, but we need help to optimize that because in a way corroborating the 12.5% of youth who ever got to talk about sex at home, only 25% of parents in that study had discussions on sex and related matters with their adolescent children. So again, we want to increase not just the quantity, but always the quality of those conversations. And lastly, Mr. Chair, the study showed that 88% of the parents interviewed think that we are able to handle our children's questions on sexual and reproductive health and related topics, while fully admitting at the same time that we're not fully equipped yet to do so. So, similar din dun sa sinabi ng DepEd about their teachers. May kagustuhan, may support for the DepEd department order and program, but asking for more capacity building. And since everything good starts, and everything bad too, but everything good starts at home, so I think the data is also showing us na parents at home too and guardians, we want to be capacitated more vis-a-vis CSE. So salamat, Mr. Chair.
Thank you for those insights, Senator Risa, that only 12.5% of youth talk to their parents about sex. So definitely we need to increase that ratio. Parents is the first, obviously it's the first encounter of any youth. So it's important that we educate our parents on how to talk to their children, what to talk to them about. It's important for our parents to be empowered. Right? Thank you for that. DILG, any comments from?
Good morning, sirs. So while the DepEd plays a central role in formal education, the DILG acknowledges the important role of LGUs of the local government units in complementing these efforts through local level implementation and support. So as the closest government units to the people, local government units have the responsibility to facilitate community-based interventions, raise awareness, and provide access to health services that support the goals of CSE. So the DILG is always here to support lalong-lalo na po sa pag-advokasya ng mga programa ng CSE pagdating po sa ating mga komunidad. So, makakatulong po kami sa DILG sa pag-promote po lahat ng mga programa po natin hanggang sa pagbaba sa capacity building ng mga issues natin sa capacity building and other policies po. So with that, the DILG also is in partner with yung sinabi ni Yusek kanina, dun sa we are now into the policy yung sa paggawa po ng ating draft circular on the protecting. So kami po sa DILG will always be here to help or aid in any advocacy na kailangan natin yung tulong ng local government units pagdating sa pagbaba ng mga programa sa teenage pregnancy at saka sa HIV. Thank you po, sir.
Malaki ho talagang magagawa ng mga local government units because they're on the ground eh. No? And they also have supervision over the barangays. No? And the PES program calls for the activation of our parents at the barangay level. No? So it's important, the DSWD is the lead agency, but DSWD should work with DILG and DepEd also to implement this. No? So the role of the local government units in organizing, even funding the PES program is very important. So please take a look at that. No? All of these programs should go hand in hand. Hindi lang CSE, hindi lang DepEd, but the other agencies should also look at this and launch their own programs. No? All right. Thank you. PSA, Philippine Statistical Authority, any comments?
Good morning, Your Honors. The Philippine Statistics Authority is a major statistical agency in charge of collecting, processing, and documenting and archiving general purpose statistics. In gist, Your Honors, we came up with some data that shows the trend in youth and teenage pregnancies during the past years. In the 2022 National Demographic and Health Survey, it showed a result that there is a declining trend in teenage pregnancy among adolescents aged 15 to 19 years old. However, there is an increase concerning the trend within the younger age group. Birth to mothers aged 10 to 14 increased by 38.6%. As for the major reasons why it happened, of course, it will be subject to research. But one of the indicators, according to the annual poverty indicator survey, is that marriage and family matters are the main reasons why the female population aged 16 to 24 were not attending school in 2017, and also in 2019 and 2020 APIS has the similar results. So basically, Your Honor, since PSA is a data gathering agency, we merely rely on data as far as the findings are concerned, without interpretation. On a personal note, Mr. Chair and Madam Chair, if you may, I was a professor for 7 years, college actually, and one thing that I noticed, there are some conflicts as far as the approach of EO12, EO31, and the RH bill is concerned. In the nomenclature alone, Madam, Mr. Chair, we refer to adolescence and childhood. We also refer to 10 and 19 years old. And we refer to a Department of Education grade level. Your Honor, some of those age brackets would not fit because when you enroll a child, he or she must be at a certain age level before entering grade 1. And some of them do not fall under the category of 6 to 7 years old. Some of them are even older because they were not able to attend immediately schooling because of one reason or another. Some of them are even entering higher education grade 3, grade 4 on an accelerated level based on their experiences. I believe DepEd would accelerate some pupils because they are too old for the grade 1 and grade 2 levels. And there are other factors. So, as far as being an adolescent is concerned, I hope the committee would also consider to have a specific age group. Instead of referring to adolescence and childhood, the space of 10 to 19, and of course, the classification of the DepEd for grade 1, grade 2, and so on and so forth. As a parent, I respect the position that parents should take an active part. But unfortunately, that is not the real case in the outside world. Of course, responsible parents would do that. But parents in different situations might not. Some of them might say that they are working in the field, that's why they have no time to attend meetings with Department of Education and Social Welfare. Some of them might be professionals but overworking in the offices. So it would really depend more on the social aspects, the educational attainment of the parents, the capacity of the teachers who will teach those sexually related subjects while you are specializing in math and physics. As a parent, I would like to believe that everything can still improve, Your Honor. Thank you very much.
Thank you for that. NYC, Attorney Pineda.
Thank you, Mr. Chair. A pleasant noon to each and everyone, to Senator Risa Ontiveros. So I would just like to add to the abundant data that has already been provided. For our National Youth Assessment Study, which the National Youth Commission conducts every few years as the basis of our Philippine Youth Development Plan, we found that out of our 4,103 respondents, 45% admitted to having sexual intercourse. And that's from the range of 15 to 30 years old. And out of that, the majority is aged 18 to 20 years old, and alarmingly, 3.11% admitted to having sexual experience before the age of 11 years old. So with that said, as the sole policy-making and coordinating body for all youth-related PAPs and policies within our country, the NYC always acts pursuant to the Philippine say that we support age-appropriate, culturally sensitive CSE or CSE, provided that there is youth participation in the crafting, in the implementation, and in the monitoring and evaluation of this CSE. I would just like to note that our PYDP is backed up by data. It is based on related literature and has undergone multiple consultations and validations as well. So our strategies are backed up by the needs and aspirations of the Filipino youth as well. And we believe that CSE will not just address teenage pregnancy, but also the alarming numbers of increasing rate of HIV/AIDS within the youth population. I would just like to add to the numbers, I would just like to report the numbers of DOH from July to September 2024. Out of the 4,595 new cases of HIV/AIDS, 32% are from the ages of 15 to 24 years old, and 47% are of the ages 25 to 34 years old. That's all po for the National Youth Commission, Mr. Chair and Senator Risa Ontiveros. Thank you so much po.
Thank you for that. We'll go on to our, we have invited guests from the different non-governmental organizations. We'll start off with the National Coalition for the Family and Constitution. We're joined by former Chief Justice Maria Lourdes Sereno and also Pastor Carlo Dino.
Thank you very much, Senator Win Gatchalian and Risa Hontiveros. This is such an enlightening forum, and I'd like to thank all the resource persons for making all this data available to the Filipino people. I hope that we will have more of this. Now, the support of government, the agencies for CSE is quite interesting, But allow me to show you a slide that differentiates sex education, sexuality education, and CSE. It is not well known in the Philippines that CSE is a technical term. That is proven by the very fact that the UNESCO uses the word International Technical Guidance. It is a brand. In other words, when you use the word CSE, you are referring to the world that has been created and is embodied by two documents, the UNESCO Technical Guidance and the WHO Guidance. Now, let's focus on the screen first to find out what these three differences are. What the RH law actually talks about is sex education. And the National Coalition says we want sex education. And you are all in agreement that sex education can address the problem of teen pregnancy and HIV. And we are fully in agreement with you. In fact, even the private Christian schools and Catholic schools teach sex education. But then it differs. So sex education from a scientific and age-appropriate way can be addressed already by the various initiatives you are doing. Now we jump to the other world, which is sexuality education. And here, you will already have concepts that you will usually find in women's and gender studies. And that is shown by the slide shown to us by Senator Gatchalian, where there is an exploration of one's own and others' sexual identities and orientation. And I heard some remark that there are really areas of concern for parents. So when you talk about sexuality education, it is already exploring identity and going to the very foundation of who we are. Lalaki ba tayo o babae tayo? And then the second is, it recognizes and respects different kinds of relationships and ways of expressing love and intimacy, which is another slide that was shown to us by Senator Gatchalian. That was in many of the lessons here in the UNESCO Education Technical Guidance. And then it talks about values, attitudes, and beliefs related to gender roles and expectations. And of course, it addresses social, cultural, and ethical issues related to sexuality. This goes already far beyond the RH law. With all due respect, with the representatives of the DepEd, the RH law only talks about what are to be contained in education for adolescents, and this is in section 14. So it says only when they become adolescent. That's pretty well discussed, and there's a consensus about the need to find out if that age is appropriate. Second, it's about reproductive health education, which falls within the first column of sex education. It requires that it be integrated only in the relevant subjects, which means you do not, unlike the focus of DepEd, which is to integrate it under the DepEd Order number 31, lahat ng pwedeng pasukan ng CSE. And then it talks about it can involve self-protection, it can involve responsible teenage behavior, gender and development, responsible parenthood. But you look at sexuality education, this already brings in the whole world of gender ideology. And there is where the great cultural debate will come in. And then you look at CSE. So it is even more dramatic than sexuality education. Of course, there's the biological aspect, which falls within sex education, and we fully agree it must be science and evidence-based. It talks about management of STIs, contraception, and safe sex practices. Well, there is a debate about what is safe sex. Because if you look at the UNESCO guidance, safe sex is basically consent plus contraception. The UNESCO documents, while it talks about abstinence, emphasizes that abstinence is ineffective. On the other hand, the fantastic research by the International Institute for Research and Evaluation made a longitudinal study of 3 countries and more than 60 state schools that concludes that abstinence, CSE is ineffective, it has a very high failure rate, and it is very promising to show, to look and study at abstinence programs, because the initial data that was being generated was that abstinence continues to be the most effective way of sexual risk avoidance. So we have 2 different concepts: sexual risk avoidance, which can be taught in sex education, and the courses against sexual abuse, etc., for the protection of children. And there is the sexual risk reduction, which CSE is about. So if there are already very strong studies about the failure of CSE in many jurisdictions, why are we continuing it? Look at the others that will be taught under the UNESCO program. Relationships, understanding different types of relationships, including friendships, romantic relationships, family dynamics. Consent, emphasizing the importance of mutual consent. Remember that this is for children. Gender and sexuality, exploring gender identity, sexual orientation, and the spectrum of human sexuality. Rights and responsibilities, educating individuals about their sexual rights. Well, we are talking about children here. Children are, is it an acceptable concept that children have the right to decide when, with whom, and how to have sex? And the importance of respecting others' rights. Values and attitudes, encouraging discussion on values, attitudes, and beliefs related to sexuality. And emotional aspects, addressing emotions, self-esteem, and mental health related to sexuality and relationships. Mr. Senator, I will go to one important, I will show the slide later, but this is one important review that was made by the Safe Schools Alliance of the UK, which is a very secular organization made up, including LGBTQ scholars, members. They basically say, whenever you allow CSE into the curriculum, the study says there are 2 mutually reinforcing documents, the UNESCO document and the WHO document. The moment you talk about sexual rights and the moment you explore further sexual identity and go to gender talk, and these are LGBT people, then all protective protocols, and the most protective protocol is safeguarding, immediately break down. They canvassed all kinds of studies, all kinds of curricula and materials that were spread in the UK. It was uncontrollable. And that was your concern, Mr. Senator Gatchalian, when you were asking, when you were training teachers, kaya ba nila mag-refer sa UNESCO? Ang sinasabi ng Safe Schools Alliance, the moment ginamit mo yung brand na CSE, it's a brand, it's a technical term. Siyempre, papasok yung mga dokumento, and the moment those documents come in, bukas na. It's like an open door. Hindi mo na yan masasara. Kasi ang exploration of the materials that our children will be exposed to is just outrageous. It's just outlandish. So, and then, of course, they talk about emotional aspects, the feeling. Kaya nakakita kayo ng slide kanina ni Senator about how do you feel when you touch your body. So, sa Pilipinong magulang, nakakagimbal na ang mga ganito ay nag-e-exist. Ito po yung picture ng 2 dokumento. Okay, and then we go down sa kabila. Next, yung thought bubble. Ito po ang mga pinag-uusapan dyan. Masturbation, contraception, sexual rights, anal sex, oral sex, gender identity, penetrative, sexual intercourse, sexual pleasure, consent to sex. Yan ho ang wide open field. Kaya nung sinasabi ni Senator Gatchalian na may concern siya about the UNESCO technical guidance, nag-iisip na talaga tayo dapat, ano ba ang pintong binubuksan natin para sa ating mga anak? My position is, ang ganda na ng mga sinasabi ng ating mga government agencies. They are for sex education and we support them. Hanapin natin ang reason. Pero hindi ganito ang bubuksan. Kasi tingnan nyo, no? Ito yung sinabi ng no to CSE ng Singapore. Ayaw na ayaw nila and the Singapore government agreed with them. Ito ang analysis nila. Ito daw ang ginagawa ng CSE according to their study of the materials and what is happening in other countries. 5 to 8-year-old children be exposed to sexual behavior, teaching it as an expression of love. Senator Win, yun yung sinabi mo na expression of love, including sexual behavior. 5 to 8 must define family to include same-sex unions and other kinds of choices. 9 to 12-year-old children must describe how to feel sexual pleasure. 9 to 12-year-old children must learn sexual stimulation. 9 to 12-year-old children must affirm transgender ideology. 9 to 12-year-old children must believe in the right to marry anyone. 12 to 15 must learn non-penetrative sexual behavior. Ang pinaka-popular na itinuturo po at narinig ko na may nagturo na nito sa isang Philippine public classroom, mutual masturbation. 12 to 15 teenagers placed at risk to unnecessary sexualized close friendship. 15 to 18 must become LGBT and abortion activists. 15 years old must understand homophobia and transphobia. Nangyayari po ba yan dito sa Pilipinas? Let me go to the next slide. Yan po, isang successful program po na napresenta namin sa inyo, Senator Win Gatchalian, pati yung mga na-expose na sa prostitution ng new life, pero values-based ito. According to what is important to our Filipino children, dreams nila. Hindi ho sila tinuruan ng mga contraception, etc. Although I agree that at one point they must learn, pero finokus sila sa pag-forge ng dreams nila. Ito po ang mga nangyayari ngayon sa curriculum that was rolled out in the DepEd. Ito ho slides ko. Kinuha ko sa rollout slides nila ito. DepEd, grade 1, pagpakatao. Sexual and reproductive parts are vital parts of the body. The body parts can be described using the different sense organs. So na-shock po ako nung nakita ko, can you in a grade 1 classroom talk about your sexual parts? May maliliit na babae at lalaki dyan. Taste, smell, hear, feel, di ba po? Ano pa ba? See. The sexual parts of everyone. At nung nakita ko yung kung anong mga nandun sa ibang mga bansa, kung paano ito tinuturo, yung differences, pinapakita talaga graphically. And ine-emphasize that everybody has a different sexual part. That's very young. Grade 1, kinder, etc. Pinapasok na ho. Sa grade 3, pagpakatao, slide 27, sexual and reproductive parts, inuulit po nila. Kaya, sir, from the DepEd, tingnan nyo po yung mga slides na rinol out nyo noong 2022 September. Kasi pinakita nyo po sa lahat ng teachers na pwedeng kapkapan ng katawan ang isa't isa sa isang classroom, hipuin, pag-usapan, tingnan. Babae at lalaki, walang magulang. Then, grade 3 sa science, ganon din po. So, nandiyon yan sa grade 1, nandiyon yan sa grade 3. Then, pagpunta po sa slide 40, ang content po, ano ang issue na pag-uusapan? Imbis po na, ito hindi ko naiintindihan paano ipapaliwanag sa ating mga guro. Gender and sexuality. At kung titingnan nila ang UNESCO guidance, lahat ng klaseng gender ay pwedeng tanggapin, basta't self-defined. Reproductive health law, same-sex marriage, grade 10 po, ine-expose na sila sa ganyang possibility, prostitution at pang-aabuso. Bakit hindi pag-usapan ang marriage na heterosexual? Bakit ang same-sex ang ipapasok? Ang content standard po, ang mag-aaral ay pag-unawa sa kahalaga ng pagtanggap at pagtanggal sa paggalang sa iba't ibang perspektibo na may kaugnayan sa samot-samong issue ng gender. Tingnan niyo po yung next set of slides. Dito po sa Araling Panlipunan, Performance standard, ibig sabihin po dito gradean ang bata. Ang mag-aaral ay nakabubuo ng dokumentaryo na nagsusulong ng paggalang sa karapatan ng mamamayan sa pagpili ng kasarian at sexualidad. Ibig sabihin, you choose your gender and your sexuality. Learning competence, natataya ang bahaging ginagampan ng kasarian gender role sa iba't ibang larangan at institusyon. At dun sa higher paragraph, nasusuroy ang iba't ibang salik. Ibig sabihin po, magre-research sila ng gender discrimination sa bahay. Kung ako teacher, ibig sabihin, magkwento nga kayo anong nangyayari sa bahay nyo, anong sinasabi ng nanay nyo. Tama ba na mayroon tayo mga same-sex relationship? At ang mangyayari po ay, basically, it's making our children talk about what is happening in the home, violating the constitutional requirement that the state shall protect the sanctity of family life. At i-report yun, ma'am, sa bahay po nila, ayaw po nila na kami ay nagbibihis, babae o lalaki, kontra sa aming mga biological sex. So you can understand already that the gender activism is being promoted by CSE. This is not RH law. So, in slide 41, it says that you should research on the different gender roles in the different parts of the country. So there are going to be gender ideology researchers na ipapaliwanag ang iba't ibang salik na nagdadahilan sa diskriminasyon, sa tahanan, paaralan, trabaho. Meron pa nga dito, hindi ko makita yun, pati sa church, no? So what are our children at the age of what? 14, 16, 15. Galit na sa atin. Galit na sa generation ko. Kasi hindi ina-affirm ang belief nila kasi kailangang maging learning competency nila na ang gender natin is ano ang ating gusto at ano ang ating pipiliin. So that at the time, there should be sensitivity to acceptance of the sexual aspects of personal identity. Ganun na lang po ba ang ating emergency na kailangan nating bulabugin ang pagkakilala ng ating mga kabataan sa kanilang mismong identity. Kung anong pagkakapanganak nila, bakit hindi natin kailangan gawing komportable sila doon? Bakit kailangan matakot sila at ma-introduce ang concept ng identity crisis? Ayan po nga, sa grade 8 pa lang, as early as grade 8, this is 12 to 14. Ano ang mga concerns daw? Identity crisis. Dati po ang dato natin, wala tayong identity crisis. Pero dahil may iba ng mga pag-uusap na nangyayari sa lipunan at sa tingin ko pati sa school, ayan na, pag-uusapan ng identity crisis, sexual identity and sexual behaviors, premarital sex, teenage pregnancies, and abortion. And then, i-explain ang health benefits. So, cost-benefit analysis ang itinuturo, hindi dreams. Hindi po yung mga religious, mga foundational values. Kaya kampiho ako sa inyo lahat. Tamang sinasabi nyo. Kaya lang ito po ang ituturong karagdagan na ngayon lang po natin pag-uusapan bilang bansa. And then ito po, bago mag-graduate, kailangan kaya na ng bata na mag-explain that there are many ways of expressing love and that sexual activity is a mature way of showing care and affection. And identify ways for friends to express feelings to each other. Show positive attitude to the expression of admiration, friendship, and love. Ito po ba ang pinag-usapan natin sa RH law? Hindi naman po, di ba? This is beyond the RH law. This is illegal and unconstitutional expenditure of public funds for an intended cultural transformation to which Filipino parents have never agreed to. So yan ho. And then I will show you, no? Yung 3 portions po. First column, the left column is the DepEd slides I showed. The second column is some of the slides that Senator Win showed. And the last is the WHO. Ganyan din po. Pare-pareho ho. Itong mga concepts na ito ay kinuha sa UNESCO o sa WHO. Compatible ho sila talaga. Ayan po. Hindi ko nababasahin kasi binasa ko na. Yung iba nga sinabi na nga ni Senator Win Gatchalian. We can distribute these slides for you to see na parehong-pareho po ang track, Ang ituturo talaga, ang isisingit na nag-o-object tayo ay yung view nila ng pagturo ng gender and sexuality ideology. Ibang-iba ho dito yan. Tingnan niyo po ang sabi ng DepEd. Ano ba ang CSE? From their own mouth, ito po ang slide nila. Rights-based, gender-focused approach to sexuality education. Tapos, dun sa pinakakanan, okay tayo sa gitna, no? Yung sa HIV, yung STIs, scientific development, good. Maganda po, DOH. Good, go po tayo dyan. Pero tingnan nyo yung sa kanan. Includes discussions about family life, relationships, culture and gender roles, and also addresses human rights. Yung right to sexuality of children is made into a human right. Bakit po? Nasaan yung parental authority natin? If children can decide when, with whom, and how to have sex. And threats such as discrimination and abuse. Okay. Tingnan nyo po, kung ano, yung tinatanong nyo po, Senator Win, naintindihan po ba ng mga teacher kung ano ang CSE? Ito po ang pagkakaintindi nila. Yung unang slide po, ito po ay sa Facebook page. Naka-entry na ang CSE. Comprehensive Sexuality Education, CS members, CSE officers, sineselebrate nila. All of them are wearing rainbow-colored clothes, signifying that it is a win for the LGBT community. Second, yun pong post tungkol sa implementation ng CSE. Ito po kasamang AHF Gabay Community. So, successful daw po na linunch nila ang CSE at namigay sila ng condom. So, ang CSE associated sa LGBT at sa distribution ng condom. Hindi ko alam ngayon, Senator Win, napakaganda yung tanong mo, paano hindi malilito ang mga teachers kung ganito na nga. In fact, doon sa mga kwento sa amin ng mga magulang, ito na po ang mga nahalaw namin. Number one, kinakabahan ang mga teachers. Some feel that their religious convictions are being violated. Some told the parents na i-promote na ang CSE at wala kayong magagawa. Shocked ang mga parents. Meron na po sa eskwelahan at willing naman siyang itago lang ang kanyang pangalan at personalidad. Sinabi na ang CSE ay tinuturo na kailangang ituro paano maglagay ng kondom. Yung isang teacher, at ito po ay sinabi rin ni Secretary Briones sa amin, hirap na hirap yung mga teacher, lalo na pagdalaga, na magturo kung paano i-handle ang kondom. So ang ginawa ng teacher, gumawa na lang ng video mula sa internet para pakita kung paano i-handle ang kondom kasi hindi niya kaya. Another classroom, ang sinabi naman daw, yung paglagay ng kondom para i-demonstrate, linagay sa TV remote control. So, nagkakaiba-iba ho ang pananaw tungkol sa ano bang dapat ituro. Makikita nyo maraming takot, pangamba, na parang pati yung mga paniniwala nila ay sasagasaan. At yun ang malimit na pinag-uusapan ngayon sa mga sirkulo ng mga parents na nababahala tungkol dito. Ang reference ho dito ay yung DepEd Memo Order 2018. Alam ho natin lahat yan, no? At ito na nga po ang reference sa UNESCO. Yun yung tinanong niyo po, Senator Win, itong UNESCO ba susundan? Wala hong makakapigil na ang curriculum natin ay magiging kahit pa paano kukuha sa UNESCO. At sabi dun sa Safe Sex Alliance, no? Konti lang ang kaya mong kuhain sa UNESCO guidance na hindi na alam ng mga health authorities ng iba't ibang bansa. Kaya si DOH, Yusek Domingo, napakadami niya ng alam, pwedeng doon na natin kuhain yung field of knowledge from the health professionals. Ang sinasabi nila, hindi pwede yung documents na ito kasi manggugulo talaga. Kaya kailangan pong tanggalin ang word na CSE from any Philippine law, any policy, or any program kasi nakita nyo, ang kanilang pinakapuso ay pag-defend ng right ng mga bata to have sex. Ito po ang funding nitong programang ito. Nakita niyo po, without authorization from the legislature, gumamit na sila po ng GAD Fund, CEF, MOU, at sinabi nilang kukuha sila ng Memorandum of Agreement with UNFPA, UNICEF, POPCOM, and other NGOs. So ito na po ang nangyayari. At balikan ho natin paano pumasok ang CSE sa mentality at paano naging popular. Ito po ang timeline na ang DepEd mismo ang nagpakita. In 2005, sabi ng DepEd, ang UNFPA, tumulong sila sa Adolescent Reproductive Health Program. Maganda po yun, no? Life skills-based research, and we thank UNFPA for that. In 2005, yung ARF materials ay na-develop at ginamit na nga ng Bureau of Elementary Education. 2009 po, research-based monitoring and evaluation of the project implementation was conducted in schools. No po? Sorry po, opo. So ito buo na. Okay. 2009, nag-research po sila. Noong 2009 po, nagkaroon na ng UNICEF videos na tumutulong para i-address ang HIV among high school students. And then at the same time, in the same year na po, nagkaroon na ng guidelines ang DepEd against teaching about child sexual abuse. Pero critical po ang year na 2015. Yan po ang pagtuunan natin. According to the DepEd, inauthorize nila ang Likhaan Center for Women's Health, which is headed by Dr. Sylvia Claudio right now, and PLCPD. Ma'am, with all due respect, kayo po ang present chairman ng PLCPD, pero baka hindi ho kayo chairman noong 2015. Ang DepEd ay inatasan na maggawa na ng CSE. Wala pang CSE in any law, in any executive order at the time. Pero pinagawa na ng CSE standards. So, tanong ko po, na-clear po ba ito sa Senado at sa Kamara, nagagawa na sila ng masyadong radikal na programa na lampas-lampas sa RH law. Nagva-violate pa nga ng RH law. So, itong PLCPD po, at thank you po, sir, na nandito kayo, ito po kasi ang kanilang legislative agenda. Magna Carta, Adolescent Pregnancy Prevention, Repro Health Law, SOGI, and of course, dito po sa Adolescent Pregnancy Prevention, yung CSE po, basically, ay medyo supporter sila. So, ang tanong ko po, as a matter of conflict of interest, kung ang Board of Trustees po ng PLCPD ay nag-agree na may legislative agenda, at yung Board of Trustees na yon are made up of senators and congressmen, nauna na pala po magdesisyon, hindi po ho nakakonsulta ang taong bayan, may mga experts po at may NGOs involved, nasan po ang mga parents? Tandaan po natin, yung Repro Health Act, pati yung Parenting Effectiveness Service Program, both are very important bills. Inuulit nila yung nasa konstitusyon na pamilya ang sentro ng pundasyon ng bayan, na hindi pwedeng mabawasan ang parental authority, na ang religious freedom ay assured. At sa Article 4, Section 4, sabi nga, walang kahit anong batas, polisiya o programa na iusad ng hindi kasama ang mga magulang. Ang data ho natin will show na ang lakas-lakas ng religiosity ng Filipino parents. Na-consider po ba ang religious convictions? So, ito po na paliwanag nyo na lahat na nagdi-decrease ang teenage pregnancy at nakakatuwa na nagdi-decrease, pero may problem pa tayo sa yung bumabatang edad. I suggest na tingnan yan from the view of statutory rape. DOJ, nasaan po kayo? Tingnan rin po natin yan in terms of parental effectiveness program. Ang ganda po ng tanong ni Senator Gatchalian sa DSWD kung umaarangkada na nga ba yan. Kasi yan ho, ang baka ma-unlock natin yung susi tungkol dyan. At yan po, no? Talagang bumababa na ang teenage pregnancy, nakakatuwa. Pero tutukan natin po yung mga batang edad. Maganda ho yung health orientation ng DOH at ng PSA, maganda ho yung parental insights na binigay nyo. Okay, pero ito po ang kailangan nating tutukan, yung PISA. Alam nyo po, dun sa policy review ng CSE program sa iba't ibang bansa, Common ang reklamo. Ang dami ng problema ng edukasyon. Bakit tayo nagtututok ng pera, oras sa CSE na hirap at naglabag sa kalooban ng mga teachers? Kaya yung inyong pong yung assessment after the piloting, kailangan itanong, meron bang pagtutol ang mga teachers? Kasi nung kinausap ko po si Secretary Briones, ayaw daw ng mga teachers. Lalo na yung mga dalaga, ayaw nilang ituro yung ganung mga bagay. Sa Singapore po, ang sikreto nila ay mayroong mga specialist na magtuturo nito. May maganda ho tayo ipapakita. Ito po yung kanilang chart, no? Maganda ho at iiwanan ko kay Senator ito. Ito po ang failure rate. Ang taas po ng failure rate, no? 87%, 89%, 89%, 85%. Tapos, mukhang posible daw na may positive yung abstinence-only education. Kasi nakakita silang ng 17 studies. Ito ho ang recommendation nitong US-based research group that has been conducting research on sex education for more than 30 years, and it's considered as a consultant for many state education boards. Given the threat posed by STDs, HIV, and pregnancy to the health and well-being of young people worldwide, the compelling lack of evidence for school-based CSE, and the concerning rate of harmful impact, we recommend that policymakers abandon plans for the global dissemination of CSE and pursue alternative prevention strategies for reducing the negative consequences of adolescent sexual activity. Further studies of the positive findings for abstinence should be done to inform the development of such paradigms. Ito naman po, maliit nga po ang screen ko, no? Pero ito po yung sinasabi kong UK-based group na secular at may mga members pa ng LGBT. Sinasabi po, these documents, referring to the two documents, are highly influential and present a very clear and present danger to children across the world that requires extremely urgent intervention. This threat comes in the form of sexuality education, often described as positive, comprehensive, and holistic, and which seeks to sexualize the child in both theory and practice, reframing child safeguarding and parental engagement as a threat to children's human rights, well-being, and development. So, these questionable approaches are currently informing policymakers at international levels. Nalilito daw po sila. Curriculum and resource producers at national levels and educators at local levels. And harmful and sexualizing resources inspired by these approaches have already reached the youngest children in their classrooms and other educational systems. It was found that former protocols that ordinarily prevent or respond to the exposure of children to sexual material are evaporating with the introduction of CSE. These are being replaced with questionable belief that exposing young children to sex-positive graphical sexual content is essential to further children's so-called human rights, sexual rights. WHO and UNESCO standards conceptual and ideological approach undermines and misuses any ethical and legitimate case for good quality, age-appropriate, and timely sex education. I will just immediately go to ito pong slide na ito. Pag tayo ay mag-implement ng CSE at i-review na po ng UNICEF ang CSE implementation so that the DepEd will understand. Ganito po ang gagawin nilang review kung magaling kayo mag-implement o hindi. Sabi po nila, ang problema yung Thai educational institutions is very focused on reducing the incidence of unwanted pregnancy among youth and neglects the importance of teaching about gender, rights, and power. So power dynamics ang ituturo nila. This state of affairs is rooted in the origins of sexuality education development in Thai institution that has mostly been driven by the goals of reducing HIV and unwanted pregnancies, which we're all talking about. Yun ang goal natin. The teenage, as a result daw kasi masyado tayong laser focused ang Thai sa teen pregnancy and STI prevention. Sexuality education curricula are centered on prevention, but cover the root causes of related problems less fully and therefore pay little attention to teaching about respecting sexual rights and gender equality. Sexuality education in Thailand is aimed at solving specific problems. This does not correspond to the principles of CSE, namely that it must be a rights-based and gender-focused approach to sexuality education, which goes beyond a focus on prevention of pregnancy and sexually transmitted infections, UNFPA 2011. Therefore, to ensure that sexuality and education in Thailand becomes truly comprehensive, meaning it achieves CSE goals, policymakers at the ministry level need to pose questions about the general framework of education. In particular, teaching sexuality education based solely on solving specific problems may not be sufficient to equip students with analytic skills to make informed decisions about their relationships and sexual lives. Educational institutions need to place more emphasis on teaching about equality, sexual rights, and gender to cultivate attitudes that help to solve sexual problems at their root. Now, let me just go to the Singapore Ministry of Education slide. Nando sa una yun, ano? Ayan. This is Singapore. Slide 5, please. Ang Singapore, ang tingin nila, their curriculum is not religious at all. It's holistic and secular. But sexuality education is to be taught through science lessons, character and citizenship education lessons in primary schools, secondary, junior colleges, and millennia. 18 programs. It is taught in the context of mainstream national values, according to students' development needs. Mainstream national values, not far-out values that are alien to Filipinos. Our sexuality education curriculum is anchored in Singapore's prevailing family values and social norms, which the majority of Singaporeans want to uphold. Marriage is defined as being a union between a man and a woman. Sexuality education teaches students what homosexuality is and the importance of mutual understanding, respect, and empathy for everyone. In another page, however, you can see that it talks about abstinence as the most effective approach, and it really keeps on emphasizing that casual sex is harmful. So unlike the UNESCO that says, there is a line there, abstinence is proven to be ineffective and can even potentially harm the youth. So that's on record, and I can show you the part where it says that. So my point is there is a Filipino sexuality educational curriculum that we must strive for. And it is urgent because of the introduction of materials, gender identity confusion by age is now increasing. This is the slide 43, please go there. You can look at the increasing ages. Now, at the age of 31, at the age of 12, there's already a 1/3% or 31% incidence of gender identity confusion. Same-sex attraction by gender is also increasing. Is this the kind of issues we want to address in our schools? Our school system is not equipped. Our parents are disenfranchised. So I suggest that any new law, please go to 39, must be constitutionally compliant in every respect. It must be respectful of our culture and religions, rejecting gender ideology and not indoctrinating children and molding them to be activists for gender ideology. Schools must clearly say that there are only two sexes, respectful of the sanctity of family life and not encourage children to spy and report on their parents, life-affirming and not implying that abortion is a good option for pregnant women, does not look down on abstinence and character strengthening, must make children comfortable with their own bodies. Children must not be led to think an identity crisis is normal and that they have the right to choose their gender. Must allow children to walk out in the classroom in protest if their sense of right and wrong is being violated. Must always give parents the option to opt out their children, except for mandatory biology classes. must involve the parents in the curriculum and module content and not undermine their parental authority, must fall within the ambit of the reproductive health law, which basically talks about sex education, the first column, plus health concerns, plus avoiding teen pregnancy and responsible parenthood. That's what our H law is saying, not CSE. The Youth in Nation Building Act, which requires that every youth development program under Section 2, Paragraph B, must instill faith in the Creator. So the Youth in Nation Building Act, the programs of Attorney Tina, must show that there is a religious and spiritual component, that the spiritual and moral character of our youth is compliant with the Constitution in Article 2, Section 13, in Article 14, and in Article 15. So there is a duty on the part of the Youth Commission to do that. The Good Manners and Right Conduct Law, which under Section Rule 7.1.1 says that there must be an enforcement or strengthening of faith in a divine being who is the source of help. And according to the implementation design, I still believe that the Parenting Effectiveness Service Program of RA 11908 is the way to go, and must observe the constitutional guarantee in Article 14, Section 2, that religion can be taught in public schools during regular class hours at the request of parents. It must disassociate itself from the brand CSE from every angle, as well as avoid the adjective comprehensive in describing the curriculum or program, because as long as the Constitution says that there is sanctity of family life, there are things that the school cannot teach, which must be within the private sacred space of family life. It must contain safeguards in the implementation, the curriculum, modules, and the actual teaching itself. As you can see, the reports are sumasabog talaga ang CSE. To ensure that children are not taught that they have sexual rights, including to touch and pleasure themselves or others, to decide when, with whom, and how to have sex, and that sexual activity outside of marriage is a mature way of showing love. So we are fully for sex education that is science-based, solving a specific problem, meaning teen pregnancy and health, but it must be done within the ambit of constitutionally protected rights, our culture, and existing statutes. I submit that the CSE program of DepEd has gone beyond what has been authorized. I submit that we need to investigate paano ba talaga nakapasok yung concept ng CSE sa larangan ng ating public institutions. I submit that parents must be consulted and the religious sector must be involved kasi sila ang pinakamalakas na foundation for character strengthening. Thank you very much, Mr. Senator and Madam Senator.
Thank you very much, Chief Justice. And I do agree that we have to go back to the basics. That's why in the beginning of the hearing, we pointed out to the Department of Education that the reproductive health law calls for the implementation of a reproductive health education among adolescents. And that's the basics. That's the policy that our legislators, our policymakers have undertaken in order to address societal problems. But I also want to point out to the Department of Health because the IRR created confusion among all of us because, and I'll flash it, on section 11.01 of the IRR, it calls for reproductive health education to adolescents and school-age children. So we need to revisit this IRR. And if you go down to the curriculum development, baba pa. In the curriculum development, it also directed the Department of Education to include age-appropriate sexuality education, which is not in line with the reproductive health education that is contemplated in the law. In-expand ng IRR in age at in-expand ng IRR in content. But if you go down, this was also signed by it was headed by the Department of Health, but it was also signed by the Department of Education in 2013. So I call on, I'm urging the Department of Health to revisit this IRR because it's creating confusion. Sabi nga ni Mr. Corrales kanina as a parent, and I'm sure he read all of this, it's creating confusion. And that's not what we want. Because when we implement this program, the reproductive health program, it has to be very clear from a policy standpoint so that when it filters down all the way to the classroom, you have to remember this will be implemented in all of our classrooms. It's very clear to the implementers, which are our teachers. So recommendations immediately to the Department of Health to revisit the IRR and to the Department of Education to go back to the basics. And that's what you echoed in the beginning of this hearing, that the legal basis for DO 31 is the reproductive health law. So let's go back to that. Look at the transcript, look at the debates. Because that is the essence of the reproductive health law. That was the wisdom behind the crafting of the reproductive health law.
May I, Mr. Chair? Yes, thank you po. Maganda nga po itong ganitong klaseng oportunidad para po marinig namin yung lahat ng panig at saka ideas ng ibang mga grupo. Katulad po ng sinabi ko kanina, at ito po ay opportune time for us to hear all of the ideas because currently we are studying and reviewing the department order. And if necessary, we will revise depending on the decision of the EXICOM. Ayoko naman pong pangunahan yung decision ng aming EXICOM, pero in other words po, it's not an official decision of our EXICOM. Pero po just to add on the discussion, kasi ganoon naman po talaga ang layunin ng ganitong mga hearing, basahin ko lang po, if you will allow, Mr. Chair, yung aming mandato sa Section 40, tapos i-cross-refer ko lang po sa mga ibang provisions para po maput lang po on record. But again po, I don't want to preempt the decision of the EXICOM. Yung sa Section 14 ho kasi, yung Department of Education is required, mandated, to develop a curriculum with respect to the law. No? At yung law po, Section 14 din, yung first part, nakalagay po kasi doon, the state shall provide age and development appropriate reproductive health education. Tama po, reproductive health education po ang ating requirement. Ang tanong po ay, ganun po ba kakitid yung reproductive health definition o ito po ay dapat kompleto or to a certain extent, comprehensive po dapat. Yung reproductive health education po, i-define naman po yan sa definition of terms. Nung same batas o yung reproductive health po is defined, refers to the state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. So, sa RH na po, ang kanyang tinitingnan ay isang kompleto ho na pagtugon sa pangangailangan po ng mga learners ho natin. At hindi lang po yun, meron pong sumunod na definition of terms, yung reproductive health care. Mini-mention po ito, banda sa baba, it also includes sexual health. Yung nakita po sa screen kanina, doon sa bandang side ng comprehensive sexuality education, tama po, nandun po yung sexual health. Minention din ho kasi yun sa RH law natin, dito ho sa letter Q, sa definition of terms, meron pong sexual health doon. At yung sexual health po, pagkatingnan po ulit natin sa definition of terms, dinidefine ho din niya, sexual health refers to the state of physical, mental, and social well-being in relation to sexuality. So yung batas ho mismo na RH na legal basis po ng Department Order number 31 ay nagbi-mention din ho ng sexuality. In fact, madami pong beses na mention ang sexuality as a term, hindi lang po sex education. So again po, I don't want to preempt the discussion of the EXICOM which will happen on Thursday. Pero sinabi ko lang po ito just for discussion at para po sa record po ng committee. Salamat po.
Thank you. Yes, Dr. Asek Domingo. Go ahead.
Thank you, Mr. Chair. DOH supports the perspective of DepEd And in particular, gusto rin po namin i-put on the record, as correctly observed by the Chair, that the implementing rules and regulations is not an act by the DOH alone. Section 26 of RA 10354 provides that there is a composition of those that will jointly promulgate the IRR. And I will not belabor kasi nakasulat naman po yan, Section 26, 10354, which means we have to convene all of these people if we are to look at it. I say this, Mr. Chair, because in aid of expediting the process, another option is baka mag-focus na lang dun sa curriculum itself. Because Section 14 is clear. The mandate is dun sa curriculum. And also, the Supreme Court in Imbong versus Ochoa actually ruled that apart from those specific sections of the law na in-identify dun sa ponensya nung decision, everything else is constitutional. And no less than Justice Sereno mentioned in her concurring and dissenting opinion, sang-ayon ako na hindi pa napapanahon upang magpahayag ang Korte Suprema ukol sa pagpapawalang bisa ng Section 14 dahil hindi pa nakabubuo ng curriculum ang Department of Education. So, no less than the former justice, as we are hearing from her now, is actually referring to the curriculum. So, yun lang po naman, Mr. Chair. Thank you po.
Yes, salamat, Mr. Chair. So, just a few quick points and then one observation sa DepEd and then a few questions for the good former Chief Justice Sereno. So, dagdag lang po, dun sa Section 14 sa Age and Development Appropriate Reproductive Health Education ng RPRH Law, totoong ang sex education sa RH Law ay hindi limitado lamang sa biological facts. Naka-enumerate pa ang ibang mga topic tulad ng values formation, knowledge and skills in self-protection against discrimination, sexual abuse and violence against women and children, and other forms of gender-based violence and teen pregnancy, physical, social, and emotional changes in adolescents, women's rights and children's rights, responsible teenage behavior, gender and development, and responsible parenthood. Pangalawa, quickly, Mr. Chair, yung study na sinite ng good former CJ, yung 2019, Re-examining the Evidence for School-Based Comprehensive Sex Education, a global research review by the Institute of Research and Evaluation. It was responded to by a study published in the National Library of Medicine, a study that reanalyzed and reassessed the aforementioned global research review and the evidence it included to itong study of the National Library of Medicine to investigate the validity of that earlier study's conclusions and the extent to which they reflect the body of evidence on CSE na nabanggit ko nga po kanina is at least 3 decades rich. So yung re-study on the first report, nag-assess po sa 4 na aspeto ng IRE review: analytical framework, study selection and inclusion, accuracy of findings, and overall conclusions. And the reanalysis revealed several inconsistencies and errors in each of the 4 elements examined that cast doubt on the validity of the report's conclusion. In addition, it was found out the IRE report did not adhere to standards typical of scientific reviews. Its analysis of studies contained many errors, with 74% of them containing 1 or more discrepancies. The IRE report's conclusion did not entirely align with the data they themselves or itself presented. They inaccurately portrayed the collective body of evidence that they examined, and altogether, the NLM reanalysis and reassessment study showed that the IRE report fell short of meeting the scientific standards necessary to inform recommendations on CSE programs. Third, and quickly, Mr. Chair, on the Singapore example, yes, CRE's curriculum on CSE is described as holistic and secular. It is taught through science lessons, character and citizenship education lessons in primary and secondary schools, in junior colleges and the Millennia Institute, and e-teens program in secondary schools, junior colleges, and Millennia Institute. Singapore's sexuality education curriculum is organized around 5 themes: human development, interpersonal relationships, sexual health, sexual behavior, culture, society, and law. Sounds familiar po, Mr. Chair. Parang yung CSE curriculum ng Department of Education. And in Singapore, yes, abstinence before marriage is taught as the best course of action for teenagers to protect themselves from STIs and unwanted pregnancies. But the curriculum also teaches facts about contraception, consequences of casual sex, and saying no to sexual advances. Its science lessons on sex ed even explicitly include explaining how some temporary methods like use of condom or diaphragm and permanent methods of birth control like vasectomy or ligation prevent pregnancy. Their lessons recognize that temporary methods of birth control are not 100% effective in preventing pregnancy and stopping STIs, and their lessons include discussions even on artificial insemination and in vitro fertilization. Fourth, and quickly, Mr. Chair, the Safe Schools Alliance mentioned, unfortunately, is also active in the country mentioned, the UK, unfortunately, undermining the right to schooling or formal education of trans youth. Fifth, Mr. Chair, the paper mentioned, sorry, di lang ako mabilis para isulat yung buong pamagat, but the one that ends in Europe, precisely. It was a study that was commissioned for use in Europe, whereas we, Mr. Chair, in the Philippines, we are in Asia. Sixth, Mr. Chair, masaya ako sa pagbanggit kay former DepEd Secretary Briones dahil sila mismo ang pumirma dun sa Department Order number 31 noong 2018. Seventh, Mr. Chair, binanggit na without congressional permission yung paggamit ng pondo para sa CSE. That is inaccurate, Mr. Chair. I just need to quickly review the pertinent provision in the RPRH law at pati sa ang IRR sa RPRH law, which has to do with appropriations para sa CSE. Eighth, Mr. Chair, binanggit po ang likhaan, si Dr. Sylvia Orgay Estrada Claudio at ang Philippine Legislators Commission on Population and Development. I am proud to be associated with all of them, Mr. Chair, hanggang po sa ngayon. And lastly, quickly, Mr. Chair, before my few questions, sa Thailand, ang kanilang comprehensive sexuality education dates back to 1938. Halos isang century na po, Mr. Chair, and includes as of today, dahil progressive po yung legislation natin, progressive din po yung implementation mga executive, and today includes reproductive health, sexual safety, social skills, at saka yung kakayahan ng ating mga anak at mga estudyante to make informed decisions. So just one quick observation, Mr. Chair, para sa DepEd. DepEd, tama po ba na napakinggan at patuloy ninyong pakikinggan ang mga pananaw ni na former CJ Sereno at ang mga katulad na pananaw? Tama po?
Tama po. Tama
Alright, salamat po at dapat lamang po. So patuloy po na inote po ang mga ito. And lastly, Mr. Chair, a few questions for the good former Chief Justice Sereno. Dahil former CJ and Mr. Chair, nabanggit na po natin ang kasong Imbong versus Ochoa, kung saan tinalakay ang constitutionality ng RPRH law. At gaya ng nasabi ni Asek Domingo ng DOH, malaking hakbang ang pag-validate ng Korte Suprema sa RPRH law sa pangangalaga ng kalusugan ng kabataan. Bilang isa sa nagpasya rito, may ilan pong akong mga tanong sa good former CJ Sereno. Nabanggit niyo po, former CJ, na sa inyong mga nakaraang statements na hindi compatible ang CSE with the Philippine context. But you were part of the Supreme Court that upheld the constitutionality of the RPRH's provision on age and development appropriate reproductive health education on which DepEd based its department order. Pero hindi po ba, former CJ, sinabi nyo sa concurring opinion nyo sa RPRH law na, quote, nangangailangan ding mabigyan ng kaalaman ang menor de edad na nanganak o nagkaroon ng miscarriage. In your own words, former CJ, pinadiinan nyo pa ang pangangailangan ng edukasyon at tulong sa mga menor de edad na maagang namulat sa mga bagay na sexual. So, how is it now that you do not support initiatives which recognize this very idea na kayo mismo ay ginamit ito para magdesisyon na yung relevant RPRH provisions ay constitutional, Mr. Chair?
Babalik po ako dun sa aking chart. Pwede po ba yung pinaka-first slide ko? Ang tinakel ng RH law is sex education. Yun, nasa first section, plus the social policy of helping all teenagers even who are experiencing these social issues. Doon sa first column po, malinaw, pasok doon ang RH law. Pero itong CSE, which is a brand, which is a technical term, ang layo po. Kung pupunta ngayon ang CSE sa isang litigation, natatanungin, paano nyo pag-uusapan ang sexuality, ang identity, paano nyo pag-uusapan ang multiple personalities, paano nyo pag-uusapan ng identity crisis within the ambit of the RH law. Marami pong papasukan na hindi pasok doon. Compatible ang aking pananaw. Medyo yung mga mas conservative po, medyo nagtampo nga sa akin ng gusto kasi partially nag-dissent pa ako doon sa mga tinanggal nila. Kaya ang pananaw ko po, Senadora Risa, para ho magkaintindihan ang buong bayan, agree ho tayo sa sex education which the NCFC really wants. Agree po tayo sa parental equipping which the good RA on the Parental Equipping Service Program of Senator Gatchalian patterned after Valenzuela's Nanay Teacher Successful Program. Agree po tayo na kailangan ayusin ang teen pregnancy at ang health concerns. Pero kailangan po ang clear boundaries po natin, isa ko na po, may mga bagay na hindi ho pwedeng sabihin at i-justify under the RH law. Pag-usapan po natin yon under another bill, maaring sa SOGI bill po, maaring sa ibang klaseng bill, pero hindi ito justified under the RH law. So consistent po ako, ma'am.
Salamat, former CJ, Mr. Chair. Pati sa pag-affirm na nagkakaisa na tayo tungkol sa sex education, tungkol sa parental equipping, at tungkol sa paghahanap ng mga paraan na mapigilan at pababain ang teenage pregnancy dito sa ating bansa. I wish to make it of record also, former CJ and Mr. Chair, na para sa akin yung evolution ng terms at contents from sex education at sexuality education at CSE ay bahagi hindi lang ng progressive legislation, pero yung progressive na pagpapilot, pag-i-implement, pag-i-evaluate, pag-i-improve ng executive. Dahil ang batas po ay higit isang dekada na, ang mga department orders ay ilang taon na rin, and bilang mga tao ay kailangan mag-evolve din po tayo. Hindi po ito, para lamang sa akin po, in my humble opinion, Mr. Chair, hindi lamang po ito usapin ng branding. Para sa akin, ang sex education ay pasok sa sexuality education dahil hindi lang physical o biological, pero yung kabuuan ng pagkatao sa sexuality. At yung comprehensive ay isa pong adjective para ilarawan kung anong klaseng sexuality education, kung ano po yung mga subjects, kung ano po yung mga paksa. Definitely that should, and I understand from DepEd, be subject sa patuloy na improvement. And then pangalawang tanong ko po, Mr. Chair, para sa good former CJ, sa desisyon nyo rin po sa kaso laban sa RH law, sumang-ayon kayo na ang ibang menor de edad ay nararapat lang bigyan ng impormasyon at serbisyo kaugnay ng sexual at reproductive health. At ito po ang sarili ninyong mga salita. Quote, kinikilala ng RH law na hindi lamang edad ng isang tao ang tanging palatandaan upang mahandugan ng family planning services. Batid nito ang pangkasalukuyang sitwasyon ng paglaganap ng maagang pagkamulat at pagsubok ng mga kabataan sa kanilang sexualidad. Nangangailangan ding mabigyan ng kaalaman at kung kinakailangan, mahandugan ng modern family planning services kung ito ay kanilang gugustuhin. Ang mga menor de edad na nanganak o nagkaroon ng miscarriage. Bilang isang hakbang sa pangangalaga ng pangkalahatang kalusugan, ang pagbibigay ng modern family planning services sa mga menor de edad na ito ay daan upang maunawaan nila ang mga kahihinatnan at kaukulang pananagutan ng pagiging isang magulang gayong nabuntis na sila, pati na ang pagbuo ng pamilya, close quote. Sa iba pang parte, sinabi nyo na, quote, sa bandang huli, ang pasya ng may katawan ang dapat manaig. At bagamat ang may katawan ay wala pa sa hustong gulang, kung siya ay nabuntis na, hindi dapat hadlangan ang kanyang kakayahang humingi ng tulong ukol sa reproductive health, kahit walang pahintulot ng kanyang magulang sapagkat nakasalalay sa ganitong kakayahan ang kanyang kalusugan at mismong buhay. Close quote. So, base po, Mr. Chair, former CJ, sa mismong mga salita nyo noon, sang-ayon po ba kayo na depende sa sitwasyon ng ibang kabataan, talagang kinakailangan silang bigyan ng kaalaman at serbisyo kaugnay ng sexual at reproductive health, Mr. Chair?
Sagot po ako, no? Mr. Chair and Madam Senator, malinaw po ang sinasabi kanina ni Asek Domingo na kinatuwa ko na malaking bagay na buhayin ang bata o murang nanganak na. Sinabi niya na hindi pa kaya ng katawan, kaya kailangan tulungan. Yun po ang aking punto doon. Tulungan kasi buhay niya ang nakataya. Yun po ba ang pagkaintindi ko? And yun ho ang prinsipyo ko. Kung buhay na nung bata ang nakataya, lahat tayo magsama-sama, tulungan nating mabuhay ang ina.
Salamat po, former CJ, Mr. Chair. So at least nagkakaisa tayo dun sa kailangang tulungan ang mga kabataang ito at tulungan din silang buhayin. Yung kabataan mismo o kung nabuntis na siya at nanganak, silang mag-ina or silang mag-iina kung kasama pa yung halos kasing edad niya na batang ama. So, and then, inote ko lamang po, so for the record, modern family planning services are acceptable even for adolescents, Mr. Chair. That is my understanding. I see the former CJ shaking her head.
Okay, may qualification po tayo, no? When you are offering it to adolescents, may proposal kayo po, Senadora, na hindi isasama ang mga paryentes. Ang tanong ko po ano ho ang basihan na hindi natin isasama ang mga paryentes sa desisyon na kumuha ng mga family planning contraceptions na ito? Mayroon po ba itong basihan sa batas?
Mr. Chair, with all due respect, although it is the members of the committee who ask questions, but dahil gaya ng sinabi ng DepEd, importante yung pag-uusap dito, isasama ko po yung reflection ko sa tanong ng former CJ sa pagsara ko sa tanong na ito and then move on to my last couple of questions at nilinaw ko na po ito na walang pagtanggal sa parental authority sa pagkaintindi ko sa CSE o sa anumang panukalang batas na nais patuloy na suportahan ang CSE sa diwa ng RPRH law at sa diwa ng mga department orders ng DepEd or mga programa ng mga implementing agencies. And in fact, kasama po sa CSE ang mga magulang at guardians, tulad ng kasama po sa CSE ang mga guro. At particular, dun sa modern family planning information and services sa mga batang at kabataang nabuntis na at nanganak na, kapag, I apologize, Mr. Chair, it's not the topic of the hearing, pero Pag dumako na po sa period of amendments, actually naging subject na ng amendment by substitution ng isang iba pang panukalang batas, ia-align yung edad ng mga batang pwedeng tumanggap nitong modern family planning services kahit pa walang parental consent sa edad na 16, na align po sa batas laban sa statutory rape, align po sa, which is the law na binanggit na rin po ng isang resource person natin, Mr. Chair, yung batas tungkol sa statutory age of consent. Dahil kung kinikilala po natin na yung ating mga kabataan ay nandun sa ganyang mga sitwasyon at may karapatan magdesisyon, ay equip din po natin sila sa impormasyon, kaalaman at serbisyo at modern family planning methods para maisagawa yung sa tingin nilang informed decision para sa kanyang kabutihan. And before I go to my last questions for the good former CJ, Mr. Chair, inote ko rin po na sa RPRH law, ito pong Section 3 ang definisyon ng reproductive health. Reproductive health, at I think nabanggit na rin in part ng DepEd, refers to the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters relating to the reproductive system and to its functions and processes. This implies that people are able to have a responsible, safe, consensual, and satisfying sex life, that they have the capability to reproduce and the freedom to decide if, when, and how often to do so. This further implies that women and men attain equal relationships in matters related to sexual relations and reproduction. So just moving, Mr. Chair, to my last couple of questions for the good former CJ. Ayan, tamang-tama dahil kababanggit nyo rin lamang po. Patungkol naman po sa parental authority, ito po ang sinabi nyo noon dun sa inyong desisyon sa RPRH law. Quote, sa ilalim ng RH law, hindi pinagbabawalan ang mga menor de edad na may anak o nagkaroon ng miscarriage na humingi ng payo sa kanilang magulang at hindi pinagbabawalan ang mga magulang na magbigay nito. Pinapalagay na hangad lamang ng mga magulang ang makabubuti para sa kanilang anak. Sa pagsasabi na hindi kailangan ang parental consent ng mga menor de edad na may anak o nagkaroon ng miscarriage bago mabigyan ang mga ito ng modern family planning services, pinanghihimasukan ng pamahalaan ang ugnayan sa pagitan ng menor de edad at ang nilapitan nitong medical health professional. Kadalasan, pinagkakaitan ng reproductive health services ng mga pribado at pampublikong health professionals ang mga menor de edad dahil sa kaisipang masyado pa silang mga bata para magkaroon ng kaalaman sa mga bagay ukol sa kanilang sexualidad. Ang paghingi ng parental consent ang madalas na dahilan upang tanggihan ang ganitong pagsangguni ng mga kabataan. Minsan nga, hinihiya pa ang mga ito. Ngunit, kailangang tandaan na nagdalang tao na ang mga menor de edad na ito at hindi na masasabing wala silang muwang pagdating sa mga bagay na sexual, close quote. Ibig pong sabihin, walang paglabag o panghihimasok sa parental authority kung hindi naman pinagbabawal ng batas na humingi ng payo sa magulang o na magbigay ng payo ang magulang sa anak. Dagdag pa, sa sarili ninyong salita, kinilala nyo na ang ibang menor de edad ay maagang namumulat sa mga bagay na sexual at kailangang tugunan ang kanilang pangangailangan. Hindi dapat maging balakid na minsan hinihiya pa ang mga batang ito. So, good former CJ, masasabi nyo po ba na ang desisyon nyong iyon ay base sa ating 1987 Constitution at naaayon sa batas, Mr. Chair?
Ang sitwasyon na malinaw ay buhay ay nakasalalay. At yung ating DOH na nagwo-worry kasi repeated daw yung nakikita yan ng ibang datos natin. Yun ang ating pinag-uusapan dun sa mga parte na yon. So, sa larangan na yon na ang buhay ng tao ay nanganak na yung nanay, no? Hindi maaring hindi tulungan natin. Kailangan nating pagtulungan at importante na kung magiging balakid ang pagtulong sa ina, ay isang tabi na muna yung objection ng magulang sa ganong sitwasyon. Sa ganong sitwasyon. Okay, marami po tayong pinag-uusapan dito about the health of the mother. Fully on board po ang mga parientes tungkol sa pagtulong sa mga ganong sitwasyon. Kaya't nung una kaming lumabas, kami po, no, ng ating objection dun sa original bill na nasubstitutan na, noong nakita namin na hindi kasama sa pagkalinga in a strong way ang mga magulang, malakas ang aming objection. Kasi kailangan kasama. Kasi wag nating i-presume na ang mga magulang ay itatakwil ang mga anak nila. Maraming Pilipino, kukup-kupin pa sila. So yung attitude at approach, kailangan ayusin natin sa anumang bill na ating gagawin. Sa alang-alang, maraming matitinong mga magulang, bagamat mayroong mga magulang rin na kriminal. Yun ang pinag-uusapan ko doon. Sa awa natin, sa buhay ng ina at sa kanyang sanggol, kailangan nating tulungan.
Salamat, Mr. Chair, at sa former CJ. Nagkakasundo po tayo na indeed, buhay ang nakasalalay, buhay ng batang ina, buhay ng kanyang baby. Kung kasama, ideally, sa prosesong ito, kung kasama pa yung batang ama, buhay nilang lahat ang nakasalalay at hindi maaring hindi tulungan. Pero for the record, Mr. Chair, hindi po iyan yung sagot ng good former CJ ang sinabi ninyo po noon. Dahil dun po sa decision ninyo sa RPRH law na binasa ko po yung ilang bahagi, wala po tungkol sa paglimita sa life-threatening situations lamang. At malinaw po yun sa ipinut on record kung muli. Malinaw po sa records ng korte ang paliwanag po ninyo noon sa inyong desisyon at iniiba lamang sa sagot nyo ngayon. Pero it stands for the record. Yun po ang desisyon ko nyo noon. So, Mr. Chair, those are all my questions po for the good former CJ right now, and I will join the chair in asking questions of the other advocates at the proper time. Salamat, Mr. Chair.
Thank you. Before we move on to the other resource person, we'll hear from CJ Sereno and then Asek Domingo.
Okay. Ang context no ng RH law is very different. We are really talking about physical life and safety. And I'm happy na ang lakas ng perspective natin, natutulungan natin ang mga kabataan sa ganong perspective. Malakas din ang konteksto ng pag-uusap noon during the RH law. Pero wala ni minsan na pag-usapan ang gender identity crisis at yung paghanap ng expression ng individual decisions. Binago ng pag-uusap ngayon tungkol sa CSE ang ganong konsepto. So those are two different worlds, the RH law world and the CSE world. Please lilinawin po namin itong CSE law world ang talagang source ng objection. Fully on board tayo dun sa mga nangyayaring, mga effective intervention ng government na health-oriented. Thank you.
Yes, Asek Domingo.
Thank you very much, Mr. Chair. Gusto lang pong ilagay ng DOH on the record, baka makatulong po sa mga later discussions. Yung issue ho kasi ng parental consent, the DOH is very much respectful of the primacy of parents over their children. Nakalagay po dun sa Section 7 nung RPRH law na yung written consent ay required hindi para sa impormasyon, so pwedeng ibigay yun. Ngunit kapag modern methods of family planning, kailangan na parents or guardians. Ang operational concern po namin kasi paano kung hindi mahanap yung parent or yung guardian. So that is a very distinct operational gap. Nangyayari po yan at ang dami pong ibang alternative na hindi ko alam kung paano nila ginagawa ng paraan, so to speak, sa operations. Kasi nandun na yung minor as defined by the law, pero wala. Due diligence, wala talagang magulang or guardian. So that's one po. And then, since it's part of the agenda for this hearing po, yung dun sa HIV naman po. Dun sa HIV law, ang consent for testing is not needed. So meron tayong isang young key population member na magte-test. Tapos kaya malalaman, reactive siya, positive for HIV. The law itself for that particular domain is silent as to the need for consent for treatment. Unfortunately, because of fear of litigation, by the parents or whoever, natatakot yung mga clinicians, yung mga doktor na magbigay ng treatment dun sa minor de edad na nag-positive na. So meron kaming malaking conundrum na bordering unethical and actually really sad and kumbaga, bilang doktor, nakakalungkot kasi nakagapos yung kamay ng doktor kasi alam na namin may sakit ka pero hindi namin mabigay yung treatment dahil tahimik yung batas. At natatakot kami na baka biglang may maghabla sa amin. Because of this, I don't want to use the term itself, pero sige, sabihin ko na, chilling effect. Na parang ayokong kumilos kasi baka mamaya may humabol sa akin. So baka yun po ang isang aspeto na pwedeng i-discuss pagka napag-usapan po ang issue ng parental consent. Thank you po.
Mr. Chair. Mr. Chair, just thinking on what Dr. Domingo just told us, I hope that the committee led by the chair can examine that conundrum and maybe in its findings and recommendations consider or propose possible solutions, lalo na in the light of hindi po talaga naaabot ng ating bansa yung 95 na targets, and the youth are really among the most affected populations. I can only imagine, dahil hindi naman ako doktor, yung heartache nung doktor, they have the Hippocratic Oath to do no harm. Alam na nila itong bata ay may sakit, pero hindi po nila mapagamot. Salamat, Mr. Chair.
We take note of that recommendation, Senator Risa. Before I move to the other resource persons, I would like to ask CJ Sereno for her professional opinion on this, and this will not bind anyone, but just seeking your professional opinion, being a former Chief Justice. In the Supreme Court ruling, it says that at this point, suffice it to state that any attack on the validity of Section 14 of the RH law is premature because the Department of Education, Culture, and Sports has yet to formulate a curriculum on age-appropriate reproductive health education. Is that statement still applicable at this time, CJ? I'd like to seek your professional opinion, being a lawyer and a former Chief Justice.
As of now, it stands, Senator, meaning that the court and no court will touch it because it is problematic as of now. However, a new challenge can be brought now. Now, if the DepEd is saying that the authority in which it is proceeding with DepEd Order 31 is based on the RH law, then that's a litigable issue, which means the court is now required to interpret whether there is an excess of authority on the part of the Department of Education or the Department of Education was just fully compliant with the Reproductive Health Act. So it is actually litigable, Senator. Thank you.
We're at the point now that anyone can bring this to the Supreme Court, because at that time there was no curriculum. That's why it's premature. But now there's a curriculum. And the debate here is whether the curriculum is in line with the spirit of the RH law. And with your opinion that it can be litigated.
Yes, yes, Senator.
And what's the consequence of that, DepEd? If this will be brought to the court, then we don't have any RH education or reproductive health education. We don't have any CSE. Then we don't have anything for a very long time.
Yeah, when it's filed, Mr. Chair, probably the mode would be prohibition and certiorari, meaning the Supreme Court will be asked to nullify Department Order number 31 unless there is an issue TRO, Mr. Chair. Even with the filing of that particular case, DO 31 will still be continued to be implemented, Mr. Chair.
Mr. Chair, just to add, Mr. Chair, thank you to the chair for raising that scenario and us hearing how DepEd intends to face a possible scenario like that. And if Sec Domingo mentioned the chilling effect in those situations as we confront HIV among our youth, I really hope, Mr. Chair, that as it seems to be indicated, that DepEd will not allow a chilling effect to descend upon it, but proceed rationally, with a strong heart, and boldly on behalf of our adolescents. Kasama po ng iba't iba pang mga organisasyon ng mga magulang at guardians, mga guro din, no, so that we can leave our 10 to 19-year-olds, and especially right now our 10 to 14-year-olds, mga grade 4 hanggang junior high pa lang, with more, not less, CSE to take care of and protect and help them in partnership with our families and community organizations na hindi po natin makakalimutan yung out-of-school youth na tinutulungan ng ibang agencies ng executive. Salamat po, Mr. Chair.
Thank you, Senator Risa. Yes, Sec Domingo?
Just a quick addition to that point, Mr. Chair. Typically, sa pagkaintindi po namin, nasanin na rin kami sa DOH kasi nga in these cases of Imbong versus CHOA and other litigation, tatanungin natin, ano ba yung actual case or controversy or yung injury being sought to be prevented? Kung maghahabla tayo sa korte, typically gusto nating pigilan na may masaktan. Eh kung 132,157 na nanay na teenager or hanggang 10 or sa sulu hanggang 8 pa, yung talagang nasasaktan dahil sa namamatay pang iba dahil sa maternal mortality. Eh, ang ano ko lang po naman, ang aming naiisip ay siguro po mamarapatin na I'm sure kung sino man po ang maghahaing nung ganong habla ay paghahandaan niya ng mahusay. At ako po yung nakatingin ngayon sa ating lahat at humarap po sila sa doktor na ano yung titimbangin niya. Anong actual case or controversy or injury yung gusto niyang idaig sa Supreme Court habang nangyayari yung actual injuries and deaths ng mga nanay na teenager. Salamat po.
But a case can be made that even in the absence of CSE, bumababa yung teenage pregnancies natin. And one of which is because of the funding. I'll show you a slide. And we were also quite curious why it's naturally going down. And we looked at the slide 11, the usage of modern contraceptives by age group. And because of our age law, the usage or the availability of modern contraceptives for different ages has gone up to about 50%. So again, this is just an observation. I don't have any scientific or research that will correlate this to the decrease. But when we were analyzing this internally and trying to make sense of the decrease, this might be partly, I don't know if it's completely, but partly. No? So, yeah, go ahead.
Mr. Chair, with respect, this might not be the slide you're referring to. This is not a trend slide. This is a cross-section.
No, it's not. It's age. It's age.
Yeah,
it's age. I know.
Going down by age, Mr. Chair? Is that what you meant?
No, this the usage increase. I don't have the trend right now ready, but even at 50%, 50% of 15 to 19 years old are using modern contraceptives.
Mr. Chair, yes, this is a very good data point, but the counterfactual to this is, if in 2022, we are seeing from the NDHS data snapshot cross-section that only 48% are using modern family planning, that let's put it at 50%, that means that if 100% had access to MFP, the 123,362 who are dying because probably they don't have access to such MFP would go down. So yun po yung challenge ito. We should not be celebrating at 48 kasi dapat 100 po yan eh.
That's why my caveat here is just this is just data that we tried to make sense. We're open to be corrected if this is the right data that we will use. But definitely, if you look at the trend of teenage pregnancies going down, it can be argued that even in the absence of an RH education or CSE, there's a natural tendency of going down. Again, I will give DOH the privilege to do more research on that because we cannot just leave it as it is. I'm very interested to find out what happened, why it was going down sans the pandemic, of course. The pandemic is an outlier on why it went down. So we have a few more resource persons. UNFPA, United Nations Population Fund Philippines, represented by Dr. Laila Judain. Judain, go ahead, ma'am.
So you said it very well, Chair. So yeah, good noon to everyone, and Honorable Senator Gatchaliani, Honorable Senator Riza. It's really a privilege to be with you in this dialogue, open discussion that show again how the Philippines is well advanced in terms of democracy, because this is what we mean by democracy, is to have this open discussion and dialogue, and congratulations for that, Chair. So let me also congratulate the Philippines for the remarkable progress in building a strong legal framework on sexual reproductive health and rights, of course, to prevent adolescent pregnancy, to prevent HIV transmission, and to prevent also sexual exploitation and abuse. We are talking about adolescents that are minor, so we have to remember that it's about sexual exploitation and abuse as well. So for that, the importance of having these programs, are crucial. And I want, Chair, to share with you an investment case that UNFPA, we have done here in the Philippines, about the adolescent sexual reproductive health and rights. In fact, if the government passed the bill on adolescent pregnancy prevention and scale up adolescent reproductive health, comprehensive sexuality education, and community and youth empowerment initiatives, the health impact will be tremendous. We will prevent nearly 230,000 unintended adolescent pregnancies. We will also prevent 250,000 child marriages. We will prevent also 263 adolescent maternal deaths and over 1,800 stillbirths. This can stop the cycle of poor health and intergenerational poverty among the most vulnerable families. Looking ahead, the economic returns are immense. For every US dollar you will invest in preventing adolescent pregnancy in the Philippines, the country will double the return from now until 2030. If you sustain beyond 2030 the adolescent pregnancy prevention efforts, it will help you to boost your economy benefit cost ratio to 8. So you can see, Senator Gatchalian, how it's important to invest in the health of, and not only the health, but also all, the programs that will empower youth and adolescents to fulfill their potential. So here, I would like, to suggest some recommendations. So first is to accelerate the provision of comprehensive sexuality education for all Filipino adolescents. This comprehensive sexuality education should be age-appropriate, of course, culturally sensitive, and translated into curriculum that are teaching and learning about the cognitive, emotional, physical, and social aspect of the sexuality, and aims to equip children, adolescents, young people with knowledge, skills, attitude, and values that will empower them to realize their health, well-being, and dignity. So I want to, also add how it's important for the Philippines to invest in its adolescent. It's a golden time for the Philippines. And you are really among the rare countries around the world that you can harness this demographic dividend. 50% of the Filipinos are aged below 24 years old. So if we invest, and if you invest in the health, well-being, and mainly education of the adolescent, and to allow adolescents to stay in the educational system, you will harness this demographic dividend. It's really a golden time for the Philippines, and hopefully with a legal framework, policies, program that empower your adolescent to fulfill their potential and to be the present and the future of the Philippines, you will, achieve this. I want to share, of course, I will not repeat the data that was shared by our colleagues from DepEd, from DOH, from DSWD, but it's very important to emphasize on the number of the increased number of adolescent pregnancy aged among 10 to 14. It's increasing. Even if we are seeing, a little decrease, for the adolescent pregnancy aged between 15 to 19, but 10 to 14 is increasing. And here, it's important also to notice that HIV incidence is increasing among adolescents as well. Maternal mortality rate is increasing in the Philippines. It's really sad to see that I arrived 4 years ago in the Philippines. The maternal mortality rate was 108 per 100,000, a newborn. Now, recently, I heard from, the estimate rate is 180. It's increasing. In 4 years, it's increasing. Of course, percent of young males have no material resource of information. They don't have resources from where this information. And because they do not have access to correct information, they are likely to rely on social media. 31% of the boys and 26% of the girls are seeking information from social media. And we know how the social media can influence them, And 40% of boys and 22% of girls are seeking information from their friends. So do the friends have the right information? So from where the information for this friend and boys and girls needs to come? Department of Education. Comprehensive sexuality education in school is crucial, is really important. And I'm really very happy to see that, already 50% of the teachers were trained, because this is what we are saying. Comprehensive sexuality education framework, the international framework, is a just framework that needs to be translated into curriculum that is culturally sensitive and age appropriate. If we start at 10 years old only, so how we can, change the curve of this, pregnancy among 10 to 14? We need to start even before 10. But, of course, it should be age appropriate. We are not teaching them sexuality like this. It's to tell them how to say no to, any sexual exploitation. It's really very sad. I traveled because of the typhoon in many, regions in this country. And I, met mothers that their girls, aged 6 years old, they were raped during this humanitarian crisis. So this is why it's really very important to inform, the young girls and boys about their body. What is their body? And how to say no to something that they don't want to, to have and to face. And this is it. no more than that. So this is really very important. And of course, and we shared with you all, the evidences that showing that CSE does not support sexual initiation. The best available evidence is the 2015 Global Review on Comprehensive Sexuality Education. Evidence has confirmed that sexuality education does not hasten sexual activity, but has a positive impact on safe sexual behavior and can delay sexual debut. We know here in the Philippines, we have, NEDA is, conducting with University of San Carlos a longitudinal study. It's a cohort of Filipino adolescent that started in 2016. This longitudinal study gives us a very important data and information. One of these, that the age for sex initiation in the Philippines is 14.6 years old. So we need to inform them how to protect themselves, how to avoid any unintended pregnancy, how to avoid any STI and HIV. So this is what I said, globally, it shows that, and we have evidences, that the comprehensive sexuality education delay sexual debut. A Cochrane review of 41 randomized controlled trials in countries like United States, Nigeria, Mexico, also confirmed that CSE prevents unintended adolescent pregnancies. In Indonesia, where they integrated also comprehensive sexuality education among students aged 12, 15 years old, they observed the positive change, increased comfort when talking about puberty and body-related topics, feeling more positive about the changes happening because of puberty.
Ms. Laila, can I interrupt you for a second? Senator Risa needs to go to another meeting, so we'll allow her to propound her question. So, yeah.
Thank you, Mr. Chair, and thank you to Dr. Laila. I'm sorry to have to interrupt, but just to leave a question, whether for you or also especially for the PLCPD, I just wanted to ask from the perspective of PLCPD and maybe UNFPA, can you give examples from other countries for how CSE was tailor-fit to the cultural context? You mentioned earlier culturally sensitive, and how such tailor-fit CSE to the cultural context of those countries achieved optimal outcomes. Just to tell us, PLCPD and UNFPA, is it possible that CSE is not a straitjacket, that from your experience on the ground and from your documentation, PLCPD and UNFPA, that it is possible to have a culturally sensitive CSE, tailor-fit to our context, and delivering optimal outcomes. Thank you so much, Mr. Chair, and to all the resource persons.
So, do you want to answer from them, or yeah, anyone from PLCPD, Child Rights Network, or UNFPA, or UNESCO? Anyone from the NGOs?
So, stakeholders, and at the end, they developed their curriculum and they implemented. And we saw, in Indonesia, a very good, success on that. I can give also the example of my own country, who is Muslim country, Tunisia. I'm a Tunisian, I'm coming from a Muslim, a Muslim, environment. And we started implementing comprehensive sexuality education, and we started with sexuality education, and after that we made it more comprehensive, tackling other issues rather than, health issue, since 1990. And now we can see how it affected, positively the adolescent and young people. We have, the rate of education, the most highest rate of education in Muslim, countries. We have, the best health indicators for our adolescent and young people. The maternal mortality rate is really decreased a lot. We don't, even the adolescent pregnancy is, rate is very, very low. So we have many, successful, examples, and I can come back to you, Senator Riza, with, more comprehensive and Chair with more comprehensive, information about all of these good examples around the world.
Thank you so much, and maraming salamat din po, Mr. Chair.
Thank you, Senator Risa, for joining us today. And before I throw some questions to Dr. Leila, we'll continue with the other resource persons. We're also joined by Deputy Assistant Secretary Ambrosio and CISO for the Philippine National Commission for UNESCO. Yeah, go ahead, sir. Yeah, thank you.
Good afternoon, Mr. Chair, honorable senators. Yes, I am actually from the DFA United Nations office, but I am joined by our UNESCO National Commission colleagues in this chamber. The DFA underscores its appreciation for the proposed Senate resolution, which seeks to strengthen existing comprehensive sexuality education of the Department of Education and to integrate effective preventative measures in the education system amid rising incidents of adolescent pregnancy and HIV infection among the youth. The DFA recognizes that the technical expertise and health-related aspects of the issue are primarily the domain of the DOH, the DepEd, the Commission on Population Development, among others. Nevertheless, the DFA is one with the Philippine government in achieving the country's development goals, promoting and protecting the human rights of all Filipinos, including children, and fostering economic growth on its path toward becoming an upper middle income country. The Philippines is, of course, one of the 51 founding members of the UN and a state party to the 8 core international human rights treaties, including the Convention on the Rights of the Child, the International Convention on the Elimination of All Forms of Discrimination Against Women, and the International Covenant on Economic, Social, and Cultural Rights. The Philippines' policy actions that are taken nationally or on the domestic front must align with its international obligations, including but not limited to the aforementioned Human Rights Conventions, as well as its participation in the UN and other multilateral engagements where applicable. These include the International Conference on Population and Development, or ICPD, the Program of Action, and the Sustainable Development Goals. In particular, on adolescent pregnancy and the high incidence of HIV/AIDS cases, we are one with concerned implementing government agencies in upholding that the best interests of the child, as set out in the Convention of the Rights of the Child, should be our guiding principle. In gist, the DFA supports the ways forward with a view to strengthen comprehensive sexuality education, or CSE, as we understand it, to be aligned with our national realities and for it to be culturally sensitive and age appropriate. So at this juncture, I want to thank the Chair for recognizing the DFA and UNACOM and for allowing us to propound our viewpoints. Thank you, Mr. Chair.
Thank you for that. And we call on Mr. Dongeto of Child Rights Network.
Maraming salamat po, Senator Gatchalian, at magandang hapon po. Ang Philippine Legislators Committee po ay convener ng Child Rights Network, and CRN is composed of 65 organizations from government, civil society, and international organizations. Matagal na po kaming nagsusulong ng mga batas para sa karapatan at well-being ng mga bata. 3,343 young adolescents ang nabuntis ng 2023. Pagsamasamahin po natin ang lahat ng kwarto ng Senado, kasama po ang plenary session, hindi po magkakasya itong 3,343 mga bata kasama ang mga babies nila. Noong 2021, naglabas ang UP, University of the Philippines, ng Young Adult Fertility and Sexuality Study at sinasabi po ng survey, Mr. Chair, na ang mga kabataan, kasama po ang bata, ay kumukuha sa social media ng mga impormasyon hinggil sa kanilang sexualidad. Kung ikukulong po natin ang debate sa parental authority at lilimitahan ang pag-address ng teenage pregnancy at pang-aabuso sa mga bata, 3,343, 10 to 14 years old, Mr. Chair, ito po ay incest at rape. Nagaganap po ito sa loob ng tahanan, sa loob ng mga bahay. Mga tatay, uncle, kapatid, ang gumagawa po ng pang-aabuso. Hindi po pwedeng talikuran ng pamahalaan ang responsibilidad na ito. Hindi po pwedeng ikulong sa CSE ang usapan. Sapagkat may kagyat na pangangailangan na huwag lumaki ang bilang ng mga batang biktima ng karahasan. Kami po, Ginoong Chair, ay sumusuporta sa bill na gustong palakasin ang programa ng DepEd sa Comprehensive Sexuality Education sa punto de vista. Kailangan po nating i-empower para magkaroon ng fighting chance ang mga bata na labanan ang pagsasamantala. Dahil hindi naman po napapag-usapan sa loob ng tahanan. Tabu po ito. Kami po ay mga magulang din, nationwide. Ang nagsulong po ng reproductive health law ay hindi lamang pangunahin ng PLCPD. Milyong mga Pilipino po, mga magulang ang nagsulong ng batas na ito, na ngayon po ay kino-question na naman. Because it has a very important feature, which is reproductive health education. Yung evolution po, nabanggit ang PLCPD kanina, para po kami nagpupuslit ng illegal. Just to correct, Mr. Chair, hindi po kami kasama sa bumuo ng curriculum, no, as presented earlier. Kami po ay kumakausap sa DepEd para tugunan na, no, i-implement na since 2014 when it was declared not unconstitutional, the reproductive health law. Panghuli lamang pong punto, Mr. Chair, kung tatalikuran po ng pamahalaan ang problemang ito, saan po kukuha ng edukasyon sa kanilang pangangailangan ang mga batang Pilipino? Magtutuloy po yan sa internet. At yung mga magulang naman po, tutulungan din naman. Wala naman pong sinabi sa RH law. Wala po sinabi sa bill ni Senator Risa Ontiveros. Wala po sinabi sa DepEd curriculum na tatanggalin po ang parental authority. Wala po. Pero mga magulang din po kami. Bakit po kami pabor? Hindi lang po sila ang mga magulang. We are all parents. And we know that it is our responsibility, but we should allow the government to address this problem. Because comprehensive po ang approach. Tahanan, pamahalaan, komunidad, mga magulang, at bata. Maraming salamat po, Mr. Chair.
Thank you, Mr. Dongeto. I'd like to ask questions. Anyone from our NGOs, from UNFPA, from CRN, Child Rights Network, or from UNESCO? Deputy Assistant Ambrosio, NC. So you're representing UNESCO or DFA? Or
No, sir. I am, Mr. Chair. I am from the DFA, and then there's a UNESCO National Commission, which is the Philippine arm that is the secretariat to how we implement UNESCO in our country, but not UNESCO, the UN agency.
Okay, yes. So you're the
we're from DFA. Yes.
DFA, yeah. But you're with the government.
Yes, sir.
Okay, all right, thanks. Maybe to UNFPA, you've heard the discussion, Miss Dr. Laila, earlier, and I do agree that what was contemplated originally, no, in the RH law is the RH education, or commonly known as sex education. And then, and I also agree that there's a distinction between sexuality education and comprehensive sexuality education. Big distinctions. No? And I do agree also that sex education / RH education should be taught, no, to prevent teenage pregnancies and incidences of HIV. Is sex education / RH education enough to address all of those social ills that you mentioned earlier? You mentioned about teenage pregnancies and how pregnancies can affect our economic. Is that enough to already address all of these social ills?
So what matters is what is inside this curriculum of reproductive health education or sex education or comprehensive sexuality education that will really, you know, prevent any harmful practices that can, you know, hinder the development of our adolescent. And mainly for the adolescent to stay at, you know, at school or have any issue related to their health. But also, you know, we are talking about, of course, HIV, STIs, you know, infection because it's raising here in the Philippines. We are also talking about adolescent pregnancy because it's very high here in the Philippines. But we have also to talk about sexual exploitation and abuse and violence against, you know, and sexual violence against adolescents, and how to prevent this. What kind of, you know, social barriers that are, you know, that needs to be changed through, you know, the education of, you know, of course, information of adolescents, but also community, parents, teachers, health workers, so that they can provide necessary information and services. Because I was interrupted by Senator Riza, but it's not only comprehensive sexuality education that is a mean to, you know, decrease adolescent pregnancy or STI. It's also access to reproductive health services. And this is very important for, you know, the adolescent to have access to the reproductive health services. And it needs to be available, affordable, accessible, and of quality. And for that, we need also to equip our health workers to talk to adolescents and to let them, you know, be very freely, you know, access to the services. The other things is to empower, you know, our adolescents to, you know about their rights. We, you know, our colleagues from GFA talked about the commitment of the Philippines. You know that already it has been made for all these international convention and treaties. But, and one of the important convention is, you know, the Convention of Child Rights. Yeah? So here also, it needs to be, you know, a comprehensive approach from the government to support young people to be empowered, to know about, you know, what is offered to them also, the information how to protect themselves and to get the services. The other thing that I think that is important is to equip, you know, community, parents mainly, men and boys, to be engaged in this, you know, if I may say, campaign to reduce adolescent pregnancy and HIV. So they need to be informed, and this is another program that needs to be in place. So, of course, many other, but to your question, you know, is it sufficient? Is what inside the curriculum that is very important, you know? It's not how we name things, but how, what the content of this curriculum. Is the content of this curriculum enough to respond to the needs of adolescents so that we can prevent adolescent pregnancy, prevent STI, and ensure that our adolescents will stay in the education system.
You mentioned also that it has to be culturally sensitive.
Absolutely.
Can you cite examples that a program, no, whether RHE, whether CSE, examples that a CSE or RHE is culturally sensitive? Can you cite? How long have you been here in the Philippines?
4 years.
So have you give us a Philippine example on how this type of program should be culturally sensitive?
So it's for the Filipino to decide what is culturally sensitive, you know. So this is why when this consultation is conducted among the Filipino, they need to decide what is culturally sensitive. So I think that it's UNFPA, we are here to support the government, you know, and other stakeholders to have information, to have accurate, you know, evidences, scientific evidences, support them in developing this curriculum based on these scientific evidences. But after that, it's to the Filipino to decide what is culturally sensitive.
In other words, we can have our own Filipino version of a reproductive health education. We don't have to pattern it out of UNESCO and also the WHO, and it can be a Filipino version that is culturally sensitive to all Filipinos.
So what is very important, you know, is this curriculum that is developed already by the Philippines, you know, cover all the aspects for you know, the young people that the young people needs to be, you know, informed about how to prevent adolescent pregnancy, how to prevent STI and HIV, and how to be also protected from any sexual abuse. So I think that, and this is the main purpose of these international guidelines, is to not reinvent the wheel every time. So we have, you know, scientific evidences that needs to be incorporated in the curriculum, but of course, you know, it will be age appropriate and culturally sensitive. But in the same time, you know, you have all the needed information that needs to be implemented, you know, so that you can protect your adolescent from any harmful practices.
My opinion, this is my personal opinion, that the RH education, as enshrined in the reproductive health law, is the culturally sensitive version of the CSE, meaning it's a Filipino version, because that has been debated many times in Congress. You know, we have two chambers here. No? The congressmen debated about it, the senators debated about it. It even went to the Supreme Court to be debated by the justices. And that has been the agreement among all the policymakers. No? So that's why, in my opinion, the RHE, as enshrined in the law, is the most culturally sensitive to us, because we discussed that many times. And if the concept evolves later on, no, becomes sexuality education or comprehensive sexuality education, then that's the time we debate again. Maybe in a law or through policy. But right now, as we stand, the RH law is the existing law that should be implemented. And in fact, that's the reason why President Duterte in 2017 issued an executive order to really implement it as fast as possible. You know? So having said that, I'll go back to the DepEd. So based on my information, only 157,000 teachers have been trained.
Sorry, Mr. Chair. We're verifying that information now, Mr. Chair.
Because that's also very important. I go back to implementation because, like I said earlier on in this hearing, that it's important that our teachers know what to do inside the classroom in teaching, in this case, CSE, Comprehensive Sexuality Education. And another question that came about is in the presentation of Chief Justice Sereno. She showed a curriculum. Can we show that, the curriculum? The curriculum that the Chief Justice showed earlier. Is that in our present curriculum right now?
Mr. Chair, I was looking at the presentation as well, and I cannot locate that in any of our documents, in our official documents at DepEd. As I mentioned earlier, the comprehensive sexuality education is implemented in DepEd through a series of competencies that are already there. So we're just mapping out these competencies that will eventually lead to a comprehensive sexual education program that we have at DepEd. So those documents that I see, I have to verify, Mr. Chair.
The ones in case Chief Justice in kanina. Yes. Yeah. Because that came from what I understand, that came from based on our research, from the curriculum of the pilot programs.
I am
you
not...
conducted a pilot program for CSE, and that was the curriculum contained in that pilot program.
That's right, Mr. Chair. But this one, the presentations, I'm not 100% sure. But it seems to me like these are from presentations from resource speakers. Those are perhaps the type of typology that they want to apply in the curriculum. But in the current version of the curriculum itself, I really did not see those words, the exact words.
No, my staff cross-checked this one. No? This is from the pilot program. This is when when DepEd implemented the 3-region pilot program. It contained this. Paki-zoom lang. It contained this descriptions. No? This is what CJ Sereno picked up and cross-checked earlier. Hindi kay CJ Sereno. Yeah, go ahead, CJ.
Those slides were presented in the September 2022 rollout. It was a 4-day rollout. It was presented to so many people, and DepEd made it available online. It was the September 2022, Senator, and the slide numbers are all there. You can physically see them there.
So again, there's confusion now, no?
Those things, for example, in here. But what we've shown you, for example, the mapping, that's what I have right now, Mr. Chair.
The pilot program and the curriculum is not the same.
I'll have to verify that information, Mr. Chair. Perhaps these are presentations by, again, the resource speakers about some of the framework of how CSE is to be implemented. But in the final documents that we have, Mr. Chair, those are not in there.
The final document, the final curriculum, it's being implemented right now. That has been officially cascaded to all of our schools.
That is my understanding, Mr. Chair, yes.
Okay, and it's implemented in school year 2022-2023? Is that correct?
That was the implementation year, yes, Mr. Chair.
Okay, then there's a disconnect again between the pilot curriculum, which CJ Sereno has, and we have it also here, and also what you are implementing on the ground.
We'll have to verify that information, Mr. Chair.
And like Ms. Dr. Leila mentioned earlier, this is democracy. We might not agree on our different opinions, but it's good to discuss and learn from one another. So thank you very much. This hearing is hereby suspended.